मोक्षदा चैव ओंकाराय नमो नमः। दूर करोति दुखानि सुखानि प्रददाति च सर्वदानंद रूपो यः परमेशं नमामि नमः। पितेव सर्वलोकानां यः करोति सदा हितं मातेव लालनं चैव परमेशं नमामि नमः। सर्वव्यापकं सर्वज्ञ सर्वशक्ति समन्वित अति सुंदर देवेश नमस्ते जगदीश्वर और प्रभो देश रक्षा बलम में प्रयच्छ नमस्ते अस्तु देवेश बुद्धि च प्रयच्छ वयम शूरवीरा भवाम गुरु मातरम चा अपि तात नमामि। हे प्रभु, मुझे देश की रक्षा करने की शक्ति दो। हे देव, मुझे उत्तम बुद्धि दो। हे परमेश्वर, आपको मेरा नमस्कार है। हम गुरुओं को तथा माता पिता को भी प्रणाम करें। सबको मेरा नमस्कार। So nurses have an enormous amount of knowledge and many diverse skills they spend years perfecting and developing, all the time working in decidedly tough environment where extreme stress is just a part of the job. Nurses help bring a new life into the world, care tirelessly for the sick and injured, and sometimes watch the patient they did everything to save pass away despite of their best efforts. International Nurses Day has been created so that we can pay honor and tribute to all of the nurses around the world and the incredible work they do. It is crazy to think about a world without nurses who would be there to care for us when we are not feeling well, when we are not feeling sick, when we are not feeling healthy. Nurses bring so much to our lives and the lives of the people that we love, and so it is only right that we have day that honors them to recognize all of their efforts. बराक ओबामा के एक कोट को मैं जरूर यहाँ पे मेंशन करना चाहूंगी. Nurses offered the little power of or sway on their own. Nurses mostly historically have been a force of will, a sense of common decency, and pave the way toward better care and a more compassionate society. आप सभी को इंटरनेशनल नर्सेज डे की बहुत सारी शुभकामनाएं. और आज के शुभारंभ करने से पहले मैं यहाँ स्टेट प्रेसिडेंट डॉक्टर जोगेंद्र शर्मा का आह्वान करना चाहती हूँ और ये भी बताना चाहती हूँ कि डॉक्टर जोगेंद्र शर्मा की व्यक्तित्व के बारे में वो आज इकॉन जयपुर में प्रिंसिपल हैं. फरवरी 16 से आज तक ड्यूरिंग दिस टाइम टेन्योर he worked meticulously to improve the standard of nursing education, undergraduate and postgraduate classes. And beside of working as principal, he has looked after all discipline of college for academic, postal, head of library, chairman of various college committees. Like recently, he rejoined on the post of dean on faculty of nursing, Rajasthan University of Health Sciences, and he also honored by National Florence Nightingale President Award in 2015. डॉक्टर जोगेंद्र शर्मा के लिए हिंदी की कुछ कविताओं की पंक्तियां मैं समर्पित करना चाहूंगी. सफलता के दामन में जी भर कर सोना चाहता हूँ, जो आज तक न कर सका वो करना चाहता हूँ. यह न समझो असफलता का तूफान गिरा देगा मुझे, गिर भी गया तो क्या फिर से उठना जानता हूँ मैं. मालूम है मुझे मन एकाग्र करना मुश्किल होता है, कोई भी कार्य लगातार करना थोड़ा कठिन होता है. यह न समझो रंगीन रोशनियों में मन भटक जाएगा मेरा, भटक भी गया तो क्या उसे सही रास्ते पर लाना जानता हूं मैं. और शर्मा जी की व्यक्तित्व को इंगित करते हुए कुछ पंक्तियां. बिना लक्ष्य बनाए कोई भी मंजिल प्राप्त नहीं होती, न इच्छा हो तो कोई योजना परिणाम नहीं देती. यह न समझो रात के अंधेरे में तीर चला रहा हूं मैं, चल भी गया तो क्या संकल्प की मशाल चलाना जानता हूं मैं. आई ओवर टू डॉक्टर जोगेंद्र शर्मा फॉर द वेलकम स्पीच फॉर दिस सेशन.
नमस्कार, हैप्पी नर्सेज डे. आज फ्लोरेंस नाइटिंगेल दिवस पर आयोजित वेबिनार में मैं सबको नर्सेज डे की TNI स्टेट ब्रांच की अध्यक्ष होने के नाते सबको शुभकामनाएं प्रेषित करता हूं और आशा करता हूं कि हम सभी हमें नर्सेज होने पे गर्व रहेगा और हम देश की सेवा के लिए जिस ढंग से इस नोबेल प्रोफेशन में आए उस पर हम अपनी देवी फ्लोरेंस नाइटिंगेल को फॉलो करते हुए कोशिश करेंगे उनके प्रतिरूप के रूप में कुछ हम काम कर पाए. आज ICN ने इस वर्ष की जो थीम दी है वो कोविड के बाद में एक बार देश दुनिया की सोच बदल गई। जब हर परिवार में कोविड का कोई ना कोई व्यक्ति कोविड से सफर करने लगा तो सभी को ये याद आने लगा कि उस समय अगर सबसे ज्यादा नजदीक कोई थे तो नर्सेस थे। तो आईसीएम ने जो इस बार की थीम दी, ए वॉइस ऑफ टू लीड, इन्वेस्ट इन नर्सिंग एंड रेस्पेक्ट राइट्स टू सिक्योर ग्लोबल हेल्थ, ये सभी आज जो इस बार की थीम है, चूंकि आईसीएन हमारी एक इंटरनेशनल नर्सेस की संस्था है जिसके कि सारे विचारों को हमारे सारे देश विदेश की गवर्नमेंट्स को फॉलो करने के लिए मानना पड़ता है। ऐसे में अगर इस थीम पर पूरे विश्व में काम होगा तो इसमें एक जो आवश्यकता होगी नर्सिंग लीडरशिप की डेवलप करने की रहेगी। नर्सिंग एजुकेशन में इन्वेस्टमेंट बढ़ेगा, नर्सिंग में जॉब बढ़ेंगे और नर्सें जो काम करती है उनकी सुरक्षा पे ध्यान दिया जाएगा, उनकी प्राथमिक सुरक्षा को प्राथमिकता दी जाएगी। ऐसी थीम के साथ इस बार हम अपना नर्सेज दिवस मना रहे हैं। क्योंकि आज के समारोह में हमारे प्रेसिडेंशियल गेस्ट, हमारे सबके रोल मॉडल, इंडियन नर्सिंग काउंसिल के प्रेसिडेंट, जिन्होंने नर्सिंग के लिए न केवल अपना पूरा समय दिया वरना अपने दूर लंबी सोच के साथ पूरे विश्व में एक अपना स्थान बनाया। हम सब लोग बड़े सौभाग्यशाली हैं कि हमें लीडरशिप में डॉक्टर तिलक कुमार जी जैसे एक दूरदृष्टि वाले लोग इस नर्सिंग में जन्म लिया। आज आईसीएन में भी दिलीप कुमार सर का बहुत बड़ा योगदान है। आज के हमारे से समारोह में राजस्थान यूनिवर्सिटी ऑफ हेल्थ साइंस के वाइस चांसलर, एसएमएस मेडिकल कॉलेज के प्रिंसिपल, देश विदेश के अपने चिकित्सीय अनुभव से इस पूरे राजस्थान को एक अनूठी पहचान देने वाले, जिन्होंने कोविड में राजस्थान में एक अपना मेडिकल का परचम फहराकर देश को बताया कि किस ढंग से इसके ट्रीटमेंट में हम निजात पा सकते हैं। ऐसे सम्मानित डॉक्टर सुधीर भंडारी साहब भी हमारे इस प्रोग्राम में आज शामिल है। हमारे सीएमसी वेल्लोर की डीन डॉक्टर वत्सला सदन भी इस प्रोग्राम में अनफोल्डिंग थीम के लिए हमने इनवाइट किया है। डॉक्टर वत्सला सदन अपने रिसर्च और नर्सिंग में एक इनोवेशंस के मामले में पूरे देश में जानी जाती हैं। आपके पेपर्स, आपके प्रेजेंटेशन को लेके सभी में एक अपनी जिज्ञासा बनी रहती है। हमारे डायनेमिक राजस्थान जयपुर के प्रेसिडेंट सीएमएचओ जयपुर सीएमएचओ डॉक्टर नरोत्तम शर्मा जी इस प्रोग्राम में अतिथि के रूप में हमारे साथ आमंत्रित है। कोविड काल में इनका जो एक मॉनिटरिंग और जो एक योगदान रहा राजस्थान को, वो किसी छुपा नहीं। आज इस प्रोग्राम में कमलेश लाल चंदानी जी, डायरेक्टर प्रोग्राम जेपाई को दिल्ली, भी आप सबके सुनने के लिए इसमें हमने आमंत्रित किया है। डॉक्टर आई.डी. गुप्ता साहब, सीनियर प्रोफेसर, एक्स मेडिकल सुपरिटेंडेंट, साइकेट्रिक हॉस्पिटल, एसएमएस मेडिकल कॉलेज, भी आज हमारे बीच में अतिथि के रूप में विराजित है। डॉक्टर धर्मेश शर्मा जी, असिस्टेंट प्रोफेसर PSM जो कोविड के यहाँ पर प्रभारी रहे, वो हमारे इसमें अतिथि के रूप में विराजित हैं। स्पीकर के रूप में मिसेज अन्नू कुमारी, स्टेट मिडवाइफरी कंसल्टेंट यूनिट पी राजस्थान, भी इसमें एज ए स्पीकर इन्वाइटेड है। और हमारी सारी एग्जीक्यूटिव कमेटी के सदस्य जिन्होंने इस प्रोग्राम को आयोजित किया है, वो भी इस वेबिनार में सभी अभी स्थापित हैं। तो मैं आप सबको ऐसे नर्सेज डे की इस वेबिनार में स्वागत और अभिनंदन करता हूं और अपनी बात स्वागत के माध्यम से कहना चाहता हूं कि हम नर्सेज, चाहे युद्ध की आपदा हो या वैसी आपदा हो, कोविड-19 हो या इबोला में हो, सभी लोगों ने अपनी जान की बाजी लगाकर अपना और अपने परिवार के समय को काटकर समाज की सेवा में दिया है। ऐसे में हम सबकी जो वेतन की कमियां, स्टाफ की शॉर्टेज और जो सुरक्षा की कमी है, उसकी शारीरिक और मानसिक स्वास्थ्य की सुरक्षा के लिए जो कदम सरकारों को उठाने जाने चाहिए, मैं सोच
डॉक्टर जोगेंद्र शर्मा, आप म्यूट हो गए हैं।
नई पीढ़ी
अभी ठीक
अच्छा, आ
रही है सर, आ रही है।
अच्छा अच्छा। तो आज हमारी जो नई पीढ़ी है, नर्सिंग छात्र हैं, जो इस नोबल प्रोफेशन जिन्होंने लिया है, मैं उनको भी बधाई देना चाहूंगा कि आप ऐसे नोबल प्रोफेशन में आपने जन्म लिया है, जिसका कि आगे समाज सेवा के साथ साथ आपके ब्रेड और बटर के रूप में भी एक मील का पत्थर साबित होगा। आपको इस प्रोफेशन में ना रोजगार की कमी रहेगी और ना सेवा की बस कमी रहेगी। तो आपकी एक सोच की, अगर आप उसको अच्छे से पॉजिटिव रूप में डेवलप करेंगे, तो मैं सोचता हूँ देश को, आपकी नई पीढ़ी को इस नर्सिंग में आने का बहुत लाभ मिलेगा। और हम लोगों का प्रयास रहेगा कि आपको आने वाली पीढ़ी को इस नर्सिंग में इन्वेस्टमेंट के रूप में एक अच्छी सुविधाएं आपको प्रदान करने की कोशिश करें। मैं पुनः धन्यवाद देते हुए डॉक्टर संता स्वामी से निवेदन करूंगा कि प्रोग्राम को आगे सुचारू रूप चलाने के लिए योगदान करें।
थैंक यू वेरी मच सर। आपका जो आदेशानुसार इस प्रोग्राम के आगे की कार्यवाही को जारी रखते हुए अगले स्पीकर को बुलाने के लिए एक श्लोक पढ़ना चाहूंगी। विद्वत्वं दक्षताशीलं संकान्तिरुनिशीलिनं शिक्षकस्य गुणा सचेतस्व प्रसन्नता। The scholar expertise, humility, generosity, wise and always in dhyanam and happy are the virtue of a guru। और आज ऐसे ही एक गुरु से आपको मैं मिलवाना चाहती हूँ। INC President Dr. T. Dilip Kumar, he is ex-project director GFATM and ex-nursing advisor to the government of India. He is having long-standing 43 years of experience in nursing. He has worked in different capacity learning, starting from staff nurse, nursing tutor, nursing superintendent, deputy nursing advisor to Government of India. He was also member of Global Advisory Group on Nursing and Midwifery of WHO, World Health Organization. He was the first nursing professional from India to become the member of Global Advisory Committee of WHO. The said committee used to advise WHO on policy issue on nursing and midwifery at global level. As a nursing advisor, he has initiated various schemes under the development of nursing services. To name few, like upgrading the schools of nursing into college of nursing, strengthening schools and colleges of nursing, continuing education of nurses, and revival of National Award of Nursing personal given by President of India every year on 12th May. As the President of Indian Nursing Council, he has initiated many reforms in the functioning of INC, Indian Nursing Council. He has also initiated many projects to name few are development of quality assurance model in nursing, development of national consortium for PhD in nursing, nurse midwifery practitioner program, nurse census development of syllabus of various nursing specialty program, and many more specialties sir is having. So I welcome you, sir, on the behalf of TNA Rajasthan State Branch, and with this poem of Neeraj, कितने ही चाल चले ये वक्त आज भले ही मात दे, किंतु सभी चालों पर उसकी निश्चय अपनी ही शय होगी, कहीं अधूरे न रह जाओ इसलिए ये तपन मिली है, निखरोगे तब कर कुंदन सा, विदना की तुम पर दृष्टि है. I over to you, Dr. T. Dilip Kumar, President, Indian Nursing Council.
Good afternoon to all of you.
Good afternoon, sir. Happy Nurses Day.
On behalf of the Indian Nursing Council, I would like to extend greetings to all the fellow nursing professionals in India and abroad. Sudhir Mandar ji, और नरोत्तम शर्मा जी, जोगेंद्र शर्मा जी is a Rajasthan TNA president and also the executive member of the Indian Nursing Council and principal of the SMS College of Nursing, and distinguished dignitaries and my fellow nursing and midwifery professionals. First of all, I would like to congratulate the TNA Rajasthan State Branch for organizing this very important event when globe is celebrating International Nurses Day. So Rajasthan Trained Nurses Association of India has taken a proactive measure to sensitize, to communicate, to inform about the theme of the International Council for Nurses. See, you must be knowing the International Council for Nurses is a global nursing professional organization which is having a membership of 130 countries, representing about 29 million nurses globally, this association. Unfortunately, India was not a member of this International Council for Nurses. The reason is we have to pay 1 Swiss franc per nurse per year is the subscription for any country to become a member of the International Council for Nurses. So you can imagine, हमारा इंडिया में कितना नर्सेस लोग ज्यादा है, उतना पैसा हम मेंबरशिप को देना मुश्किल होता था. So इसलिए ये इंटरनेशनल काउंसिल फॉर नर्सेस और WHO का रिश्ता इतना जबरदस्त है. जबरदस्त का मतलब a permanent invitee. International Council of Nurses, a permanent invitee to the World Health Assembly. World Health Assembly का मतलब क्या है? 190 countries है ग्लोब में, उसका हेल्थ मिनिस्टर्स, उसका डीजीज, उसका हेल्थ सेक्रेटरीज, 190 कंट्रीज का हर साल मई महीने में स्विट्जरलैंड में वर्ल्ड हेल्थ असेंबली होता है. इसका हेडेड बाय दी डीजी, डायरेक्टर जनरल टेड्रस. आप लोग बहुत इसका नाम अभी कोविड पैंडेमिक में बहुत सुना होगा, देखा होगा. ये बहुत इसका नाम मैं क्यों ज्यादा जिक्र करना चाहता हूं, ये बहुत नर्सेस के लिए मेरा हिसाब से इज ए चैंपियन नर्सेस, इतना इम्पोर्टेंस नर्सिंग सेक्टर को दे रहा है। बहुत दिन से WHO चीफ साइंटिस्ट नर्सिंग एक पद है, वो हमारा नर्सिंग के लिए ग्लोब में वो भी बहुत नंबर 1 पोजीशन है। ऐसा एक पोजीशन बहुत सालों से वेकेंट था। ये डॉक्टर टेड्रस ने इलेक्शन के बाद हमारा ICN ने लॉबी किया था इलेक्शन में, भाई आप DG बन जाए तो हमारा नर्सिंग का चीफ साइंटिस्ट का पोस्ट फिलअप करना चाहिए। विद इन अ मंथ वो सिलेक्शन होने के बाद DG ये पोस्ट को भर दिया। अभी हमारा WHO साइंटिस्ट कुक आइलैंड का डॉक्टर हीरो है, वो मैडम कैसे इतना 1 महीने में सिलेक्शन होगा, उसमें अपने आप एक इम्पोर्टेंट स्टोरी है। मतलब ये मैडम डॉक्टर हीरो, शी वाज ए हेल्थ सेक्रेटरी इन कुक आइलैंड, नर्स भी होके वो हेल्थ सेक्रेटरी था वहां। तो वो हेल्थ सेक्रेटरी था, ये टेड्रस भी हेल्थ मिनिस्टर था इथियोपिया का। सो वर्ल्ड हेल्थ असेंबली में आता था, इसका जानकारी था एक नर्स है, वो हेल्थ सेक्रेटरी है, वर्ल्ड हेल्थ असेंबली अटेंड कर रहा है। तो उस समय में कब ये पोस्ट को फिलअप करना, ये डॉक्टर टेड्रस ने टेलीफोन करके पूछा, आर यू विलिंग टू कम एंड जॉइन एज अ WHO साइंटिस्ट। सो एक नर्स भी था, हेल्थ सेक्रेटरी भी था, और बाद में वहां WHO साइंटिस्ट बन गया। उससे एक हमको पता लग रहा है हमारा नर्सेस का कितना टैलेंटेड, क्वालिफाइड एक लीडरशिप क्वालिटी है, तो कहां तक जा सकता है। ये हमारा एक सौभाग्य है, नर्सेस एंड मिडवाइफ्स के लिए एक अपॉर्चुनिटी है। मैं इसलिए बहुत टाइम कभी मेरा एग्जांपल्स में बताता हूं, कोई भी प्राइमरी हेल्थ सेंटर में, तहसील में हम स्टाफ नर्स का काम में हम ज्वाइन करें, वो तहसील में रिच पर्सन भी अस्पताल आना है, पुअर पर्सन भी अस्पताल आना है। डॉक्टर्स एंड नर्सेस ये रिच एंड पुअर पर्सन क्या सेवा करने के लिए एक बड़ा अपॉर्चुनिटी बहुत लोगों को नहीं मिलता है। ऐसा एक हम नर्सिंग प्रोफेशन को हम चुना है। इट्स ए, इन माय ओपिनियन, इट्स अ गॉड गिफ्ट। So therefore we should make use of this opportunity what we have got to provide a qualitative, comprehensive primary health care services in the rural population. So ये थीम कैसे बन गया, ये वातावरण कैसे ये सृष्टि हुआ, ये थीम आने के पहले क्या है, एक बड़ा इसका भी एक बड़ा स्टोरी है। 2017 में लॉर्ड नाइजल क्रिस्प, लॉर्ड का मतलब आपको पता है यूके में राज्यसभा MP हमारा इंडिया में उसका बराबर है। लॉर्ड का मतलब राज्यसभा का, वहां अपर हाउस का मेंबर है। ये लॉर्ड नाइजल क्रिस्प है, ये रिटायर्ड था, neither is a doctor nor is a nurse, is a bureaucrat. He was an ex-health secretary of the National Health Services of the government of UK. So इसको ज्यादा जानकारी था हेल्थ सेक्रेटरी को। आपको पता है एक बार हेल्थ सेक्रेटरी हो जाता है, उसको ज्यादा नॉलेज हेल्थ केयर डिलीवरी सिस्टम के बारे में ज्यादा जानकारी होता है, कौन सा सेक्टर इसमें हेल्थ केयर डिलीवरी सिस्टम में योगदान ज्यादा दे रहा है। तो इसी के लिए ये had a very special affinity towards nursing profession, because without nursing profession the healthcare delivery system will not be successful. So इसलिए 2020 was happened to be the 200-year birth anniversary of the Florence Nightingale, he made a plan 3 years earlier itself. How do we celebrate globally? Because you know that how this Florence Nightingale was belonged to a very rich family, very aristocratic family, and also इंटेलेक्चुअल का फैमिली का में ये जन्म लिया है. ऐसा एक फ्लोरेंस नाइटिंगेल वो डिसाइड किया टू गेट इनटू नर्सिंग ड्यूरिंग दैट वॉर, एंड यू ऑल नो दैट इट इज एन हिस्ट्री how she took care of the soldiers, and she was the first one to give how giving a good clean services, unhygienic services था उस टाइम पर. the clean environment provide करना है, and how we can reduce the mortality of the soldiers. A statistics was founded at that time. She was able to give to the administrators with the evidence. That's how the even now infection के बारे में ज्यादा उसका योगदान है. So such a person belonged to the aristocratic family with belonged to the high rich family took the nursing, and this Lord Nigel Chris imagined we have to give a befitting 200-year birth anniversary. So therefore he collected the evidence how nurses can contribute for the healthcare delivery system. What are some of the evidences है globally? ये सभी एक रिसर्च बना के एक बुकलेट बना के he went to the Geneva जाने के बाद ICN and WHO के साथ मीटिंग किया, एंड WHO का ICN का रिश्ता ऐसा है, कोई भी डॉक्यूमेंट है WHO नर्सिंग एंड मिडवाइफ्स के बारे में कोई भी लिटरेचर रिलीज करने के पहले ICN का वेटिंग होना है. विदाउट द वेटिंग ऑफ द ICN वो डॉक्यूमेंट अप्रूव नहीं होता है WHO में. इतना बढ़िया रिश्ता है इंटरनेशनल काउंसिल फॉर नर्सेस. एंड ऑल्सो ये परमानेंट इन्वाइटी है वर्ल्ड हेल्थ असेंबली के लिए. मैं पहले बताया 190 हेल्थ मिनिस्टर्स, हेल्थ सेक्रेटरीज एंड DGs वर्ल्ड हेल्थ असेंबली में पार्टिसिपेट करता है. उसी का वो इतना बड़ा असेंबली में ICN है, ये परमानेंट इन्वाइटी है. सो ये दोनों से मिलके चर्चा करके हम ऐसा बढ़िया एक ग्लोबल सेलिब्रेशन करना चाहिए करके डिस्कशन के बाद एक फाइनलाइजेशन होता है. वी हैव टू डिक्लेयर 2020 एज ए इंटरनेशनल ईयर ऑफ द नर्स एंड मिडवाइफ. एक डिसीजन ले रहा है ये तीन लोग, लॉर्ड नाइजल क्रिस्ट, WHO एंड द ICN. बट WHO ऐसा इतना बढ़िया एक यूनाइटेड नेशंस ऑर्गेनाइजेशन है, कोई भी चीज ऐसा नहीं कर सकता है. उसका एग्जीक्यूटिव कमिटी जनरली हेडेड बाय द हेल्थ मिनिस्टर्स, 9 to 10 हेल्थ मिनिस्टर्स होता है. वो एग्जीक्यूटिव कमिटी में इसका प्रस्ताव रखा, वो ऑल हेल्थ मिनिस्टर्स अप्रूव्ड दिस, एंड दिस द फर्स्ट टाइम वर्ल्ड हेल्थ ऑर्गेनाइजेशन is giving an importance to in a particular sector in the healthcare delivery system for the nurses. No other sector or no other profession got this type of a so far. So that type of a recognition was given by the WHO. उसके बाद ये भी डिसीजन ले रहा है, I think let us collect the global evidence of nurses and midwives करके एक स्टेट ऑफ द वर्ल्ड नर्सिंग रिपोर्ट आप सुना होगा, सोन रिपोर्ट करके एक ऑलरेडी डॉक्यूमेंट रिलीज हो चुका है. उसके बाद 2021 में इंटरनेशनल कन्फेडरेशन ऑफ मिडवाइफ विच इज ऑल्सो ए ग्लोबल मिडवाइफरी प्रोफेशनल ऑर्गेनाइजेशन है, वो भी एक स्टेट ऑफ द मिडवाइफ रिपोर्ट रिलीज किया था. ये दोनों का रिपोर्ट है, ये दोनों का रिपोर्ट का पॉलिसी फोकस क्या है वो ये थीम मैडम ने, वत्सला सदन ने आपको चर्चा करेंगे, उसका एक फाउंडेशन है. इसके मतलब वो दोनों रिपोर्ट में पॉलिसी फोकस क्या था, इन्वेस्टमेंट. आई थिंक दैट्स अ वेरी इंपॉर्टेंट वर्ड कैप्चर किया. दिस नर्सिंग एंड मिडवाइफरी सेक्टर नीड्स अ हाई इन्वेस्टमेंट फॉर नर्सिंग एजुकेशन. एंड सेकेंड थीम था creation of the nursing and midwifery professions and positions, which is a very critical for Indian condition. You can say that we have a gigantic task of creating the nursing and midwifery profession on the basis of the optimum nurse-patient ratio, whatever is available. That's a big challenge. So we don't have a the governments are not creating the appropriate positions. The third theme tha leadership. So see, you can imagine a global report, a theme ko investment of creation of positions, investment in education and leadership and service delivery. So these four themes were on the basis of the four theme है वो पॉलिसी फोकस का थीम्स लेके दोनों रिपोर्ट बन गया. दोनों रिपोर्ट के बाद 2021 में वर्चुअल वर्ल्ड हेल्थ असेंबली हुआ जिनेवा में. वर्ल्ड हेल्थ असेंबली वर्चुअल में दोनों का रिपोर्ट का रिकमेंडेशन लेके, दोनों का ये थीम को लेके एक स्ट्रैटेजिक डायरेक्शन फॉर नर्सिंग एंड मिडवाइफरी SDNM 2125 एक रेजोल्यूशन आफ्टर 10 years एजेंडा वर्ल्ड हेल्थ असेंबली में आया नर्सिंग के बारे में. यू कैन इमेजिन 10 साल के बाद एक एजेंडा आ रहा है नर्सिंग में वर्ल्ड हेल्थ असेंबली का. अपने आप एक स्पेशल है. इतना डिले हो रहा है. हाउ नर्सिंग सेक्टर is not getting even sometimes global attention. So by that time already COVID was there, and globe was experiencing how important nurses and midwives in the management of the COVID-19 patients. And at least in India, our Honorable Prime Minister himself realized how important nurses and midwives. So even he spoke, you must have heard and read and seen how our Honorable Prime Minister spoke to a nurse who is taking care of the COVID-19 patient in Pune. So such type of a visibility of the nurses and midwives was seen during COVID-19, which I think many of the common man, you might be going to the hospital, you might be cared by our nurses and midwives, but they were not knowing much. So now every common man realizes how nurses and midwives are important in the healthcare delivery system. So it was, I think, a blessing and disguise, an opportunity has given to the nursing profession to give the visibility in the eyes of the common public. That's how this STM resolution was passed. And ये strategic direction nursing and midwifery 2125 बोलता है इसको, because ना WHO काम करता है 4 साल का एक साइकिल में. तो ये रेजोल्यूशंस है, ये सभी थीम का कैप्चर किया है, इसमें रिकमेंडेशंस है. एंड ये रिकमेंडेशन मेरा हिसाब से, मेरा अनुभव के हिसाब से मिनिस्ट्री में काम करके मेरे को ये एक म्यूजिक टू द ईयर्स बोलते हैं ना, ऐसा है. क्यों ना हमारा ये 4 थीम है, बहुत पर्टिनेंट है. हमारा वी आर फेसिंग द प्रॉब्लम्स इन द इन्वेस्टमेंट नहीं है, प्लान मनी नहीं मिलता है फॉर द एक्सपेंशन ऑफ द नर्सिंग एजुकेशन और द कैपेसिटी बिल्डिंग ऑफ द नर्सिंग एजुकेशन इंस्टीट्यूशंस. Many of the government nursing schools, they don't have a faculty positions. Even at the hospital level, there is no optimum nurse patient ratio के हिसाब से positions create नहीं होता है. Leadership में nursing organization at the national level and the state level में बहुत weak है. इसके मतलब many states में नर्सिंग असिस्टेंट डायरेक्टर है, डिप्टी डायरेक्टर है, वो पोस्ट के लिए है, उसको पॉलिसी लेवल में इन्वॉल्व नहीं होता है. कोई स्टेट में वो पोस्ट भी नहीं है. सो इस हालत में दिस व्हेन द ग्लोबल रिपोर्ट इज मेंशनिंग दिस, इट इज डेफिनेटली म्यूजिक टू ईयर्स. एंड सर्विस डिलीवरी में पूरा वर्किंग कंडीशंस, क्या नर्सेस का सैलरी है, द हाउसिंग है, and safety hai, the patient safety, nurses safety, all these issues comes in the service delivery. So that means a whole gamut of the problems, challenges, issues nursing and midwifery profession kya face kar raha hai, iska pura cheez has been captured. In my opinion, this is the best theme which the ICN has selected. So therefore now what is that? Now the SDMN has come to the all countries, 190 countries, including India. Now it is for our opportunity for the professional association like Trained Nurses Association of India, then All India Government Nurses Federation, the Mrs. Kurana's group, And that's how TNA and the Indian Nursing Council, I think JAPAGO, I think कमलेश जी आपको बताएंगे. JAPAGO का मेरे को बहुत JAPAGO का नाम से बहुत मेरे लिए बहुत संतुष्ट होता है बोलने के लिए, बिकॉज JAPAGO का इतना ग्लोबल जॉन हॉपकिंस एफिलिएटेड इंस्टीट्यूशन का CEO है वो. She is a nurse, so you can imagine a nurse is heading the global organization which is working in the health, and especially with the maternal child health, and also they are working in the nursing education and nursing sector. So we have a very Indian Nursing Council and the JAPAGO working very closely in the development of various issues and challenges in India. And so therefore this SDNM, we have made you all know that by this time we have how to get this strategic direction for nursing and midwifery implemented. There is a resolution in India. We have worked nursing and midwifery for a change, a group को हम identify किया है. Already sensitization of the policy makers, political representatives का इसके बारे में हम sensitization कर रहा है. Ultimately, how to lobby with the bureaucracy, how to lobby with the political representatives to get this strategic direction of nursing and midwifery resolution which has come to India, to get it implemented at the national level and also at the state level. If we are able to implement this, I think many of the slogans are there of the WHO. If no nursing human if there is no nursing human resource, no universal health coverage. Because WHO says if you don't have a nursing human resource, you will not be able to achieve the universal health coverage, which means the sustainable development goal, you might be very familiar. The India is a signatory to the sustainable development goal, where the health indicators you will not be able to achieve, especially maternal reduction of the MMR and reduction of the IMR will not be able to achieve. So therefore, the global, national and the state level, everybody has recognized nurses are the backbone of the healthcare delivery system. So therefore, this today's deliberations, definitely I am very happy to see the Vice Chancellor from Rajasthan University of Health Sciences has joined. I think now Jogendra ji is working as a dean. I am very happy to see some of the the live register, nurse registration tracking system, which is one of the even our Honorable Health Minister in a recently held Chintan Shibar, he appreciated ours is the only regulatory body which has developed the live register. So now the Medical Council and other dental and pharmacy, they are going to start this live register program. If either Rajasthan Assembly asks the question in Rajasthan, कितना nurses है, ऐसा क्वेश्चन पूछे तो, नहीं तो पार्लियामेंट में मेंबर ऑफ पार्लियामेंट कोई क्वेश्चन पूछे कितना नर्सेस है इंडिया में, हम कितना है ये नहीं बताता है, हम ये उसको डिप्लोमेटिक आंसर देता है 1947 टू डेट कितना नर्सेस को रजिस्टर किया है उतना नंबर हम देंगे, उसमें कितना लोग काम नहीं कर रहा है, कितना लोग अब्रॉड के गया, कितना लोग डेथ हुआ है, कितना लोग घर में बैठा है, वो सभी डेटा उसी में है. उससे क्या होगा, हमारा पास रिलायबल डेटा नहीं है. In the absence of reliable data, how can we plan a effective nursing manpower planning at the state level or at the national level? Therefore, Indian Nursing Council, with the support of my governing body and the general body members, we were able to conceptualize the nursing registration tracking system. So now, as on today, we have captured Aadhaar linked 10.43 lakh nurses ka, including the photo, including the email ID, including the mobile number. We have a data, we have captured it, and shortly because of the COVID, we could not complete it. So this is one of the, I think Rajasthan University of Health Sciences first should make it compulsory, that because it is not only Indian Nursing Council objective, Joint Secretary, the Government of India, Health Secretary, Government of India has written a letter to all the state health secretaries to do this nursing registration tracking system. So therefore, I request the Rajasthan University of Health Vice Chancellor to get all the faculty of the colleges of nursing in Rajasthan. First, they should get it enrolled it. If they are not enrolled it, I think they should make it compulsory. Otherwise, they should not get the renewal of the institutions if the faculty is not there. And also, they should educate all the staff nurses working in the government and private. They should get it enroll in this NRTS. We have also gone in a very big way. I think Jogenderji, as executive committee, we have worked together in the Indian Nursing Council. We have come out with a very important 2017 health policy ke upar, nurses required specialized nurses in India. So in that perspective, we have developed a residency program called Nursing Registration Tracking. No, the Nurse Practitioner Critical Care Program, NPCC. It is just like a physician's surgeons, how they do their MD and MS. It is a 2-year fully residential program. No need of, because nurses many a times, many of the medical fraternity, they will always tell us that your nurses are good in theory, not in practical. So in that perspective, we have brought this total sea change in the implementation of the curriculum. So they are in the ICU only. So we have developed the scope of practice. And in India, at least in this COVID-19, the Mahatma Gandhi Medical College in Mumbai and also in Krishna Institute of Karad, these two intensivists telephonically told me how these our nurse practitioner critical care people came into handy in handling the COVID-19 ICUs in their respective institutions. So such a high level support we are getting from the intensivist. So I request the Rajasthan University of Health Science Vice Chancellor immediately take a policy decision of approving this, and whichever the institution, either government or private, where they have, as per our guideline, what is the stipulations are there about the ICUs, so they should sanction, and the proactive measures is required, because sometimes any new thing comes, there is always resistance for change will be there. So therefore, I think I expect the Vice Chancellor to take a proactive measure and get it implemented, because you know that already Honorable Prime Minister under the Atmanirbhar scheme, he has already made an announcement that they are going to establish 45,000 critical care beds in India. We need a nursing human resource to manage these critical care patients. So already we have come with a solution of this course. And many of the ICUs are not well managed by the trained human resource. So therefore, many of the experts have told us the nurses are the best suited for managing the ICUs. So in this perspective, my request to the Rajasthan to take a lead in sanctioning and also ensuring all the faculty, the NRTS, and any issue which again another important investment when the word comes, at least in Government of India under the National Health Mission has taken. I think you have one of the speaker, Arun Kumari, who was JPAGO representative, midwifery consultant, who is there. I think she may be sharing how NHM has taken a decision of rolling out the midwifery guideline, and they have already made a policy commitment. 86,000 nurse practitioner midwives will be trained, and also they will be establishing midwifery-led units. These are all very policy commitments which have come in, which is in tune with this theme what you people are going to hear from Dr. Vatsala Sadan. I hope today's deliberations are going to sensitize our faculty working in various nursing educational institutions. Please consult our INC website, because we have revised the BSc nursing syllabus. We have made a competency-based program. So the lot of there is no need to consult many of the textbooks which are outdated. Protocols are there. So therefore, we have included all the Government of India's latest protocols integrated, and a simulation-based method is also has been incorporated. I request, I think Jogenderji must have already seen our national state-of-the-art simulation center established in Gandhi with the support of the JPAGO, lateral, and the Indian Nursing Council, I think I request the Rajasthan University, in the interest of the improving the quality of the nursing education, they should establish similar state-of-the-art simulation center in Jaipur, so that all the faculty can be trained, so that, because you know that the patient safety is with the nurses. Like passenger who are traveling in the air, their safety is with the pilot. The pilot is generally trained through the simulation. So therefore, now it's an era in medical education. The simulation is an era for the in the medical education. So therefore, some of these issues, I hope the Rajasthan government and also the being a dean, Jogendraji will take a lead, and whatever the support facilitation is required from Indian Nursing Council, we will be willing to provide for you. Wish you best of luck. Once again, wish you happy Nurses Day to all of you. Thank you.
Thank you very much, sir, for the wishes you gave to all the population, nurses population among Rajasthan. And thank you for the information and your speech and your precious time you spent for the state DNA branch and nursing students and nurses over Rajasthan. So in each nurse, we can see that there is a real willingness to help to calm the anxieties, relieve the discomfort of people who feel bad. This very prepared and well-meaning professionals feel a greatest satisfaction in the performance of his career when the improvement in people who are attending is positive. So with this, I thank you, Dr. T. Dilip Kumar, President INC, for the time he spent. अगले स्पीकर को बुलाने से पहले एक संस्कृत का श्लोक मुझे उनकी पर्सनालिटी पे सटीक लगता है। श्रेय कत्यम न जानन्ति मंत्रम वा मंत्रित परे प्रथमे वाश जानन्ति सवै पंडित उच्यते. The person who knows his action, behavior, confidentiality, and thoughts after completion of the task is the same person who is intelligent. Dr. Sudhir Bhandari, Principal SMS Medical College, Jaipur, and Vice Chancellor, Rajasthan University of Health Sciences. Dr. Bhandari is a professional of excellence in social work with humanitarian service, senior professor of medicine at SMS Medical College and Hospital, Jaipur. He is a renowned physician and diabetologist and a fellow of Royal College of Physicians, London, Edinburgh. He has been bestowed with Rotary Foundation Fellowship in Diabetes and Metabolic Diseases of Cardiff, UK, and has been awarded Fellowship of American College of Endocrinology, FACE, and Fellowship of American College of Physicians, FACP, Fellowship of Indian College of Physicians, FICP, Fellowship of Diabetes in India, FDI, Fellowship of Indian Society of Cardiology, FISC, Fellow of Research Society of Study of Diabetes in India, FRSSDI. Dr. Bhandari has published 80 articles in prestigious medical journals and contributed chapter for the textbook on hypertension, diabetes, cardiovascular disorders, delivered more than 100 guest lectures at national level conferences and 30 at international meetings. Principal investigator of many national and international studies. He is also a member of Indian Consensus Group, which formulated the guidelines of management of type 1 diabetes and Indian guidelines on lipid management. Some of the awards received by Dr. Bhandari include Dr. P.J. Mehta Young Scientist Award, Dr. Chinna Reddy Gold Medal 3 times of Best Scientific Paper, State Merit Award by Government of Rajasthan, Best Physician Award by H.E. His Excellency of Governor of Rajasthan. At Social Service Front received Rotary International Recognition for contribution in Pulse Polio Program, Rural Charitable Medical Camps Service. He also serviced to handicapped children. Dr. Bhandari has also a unique distinction of being honorary physician to His Excellency, the Governor of Rajasthan, and all the chief ministers for last 20 years. And he also received Best and Longest Medical Camp Award by Rotary International running for 25 years. और डॉक्टर भंडारी पहले व्यक्ति हैं जिन्होंने राजस्थान में वैक्सीनेशन की शुरुआत करते समय सबसे पहला वैक्सीन लगवाया. डॉक्टर भंडारी, आपके लिए एक कविता मैं पढ़ना चाहती हूँ. स्वीकृत आमंत्रण किया, रखा हमारा मान, कैसे करें कृतज्ञता, स्वागत है श्रीमान. अर्पित श्रीमन आपको चंद्र सुवासित फूल, क्षमा आप करना हमें हो जाए जो भूल. सूरज जैसे आप हैं, हम हैं दीपक तुच्छ, क्या अर्पित तुमको करे, भेंट लाए कुछ पुष्प. वर्चुअल है, लेकिन हमारे पुष्प आप स्वीकार कीजिए। बहुआयामी आप हैं, बहुआयामी काज पाकर अपने बीच में पुलकित हैं हम आज। सुलभ नहीं होते सदा ऐसे भव्य अध्यक्ष, जो आयोजन सार्थक हुआ सार्थक होता लक्ष्य। मुख्य अतिथि ऐसे कहाँ सबको है उपलब्ध, मुदित हुई सारी फिजा बदल गया प्रारब्ध। संशय था क्या आएंगे चर्चित व्यक्ति आप, एक सरलता दंग है इसीलिए विख्यात। जन समूह की मुक्तता छिपी न जाए छिपाए, चंद शब्द मुख वृंद से सुनने को अकुलाए। So Dr. Bhandari, we are eager to listen you every time. So welcome you on this International Day. Dr. Bhandari, over to you.
Good afternoon, Honorable INC Head Shri Dilip Kumarji, our Dean Yogendraji. First of all, I extend my profound thanks and gratitude. I am humbled to have been invited. I extend my profound thanks to ma'am for using such kind words for me, and I'm humbled and honored, and it's a pleasure to be a part of your Nursing Day. Good afternoon, everyone. I welcome all of you for the webinar to celebrate International Nurses Day, that is a birth anniversary of Florence Nightingale. We all know nurses play an essential role in the society today by being advocates for health promotion, educating the public and patients on preventing injury and illness, participating in rehabilitation, and providing care and support. In fact, the nursing fraternity is an integral part, and it is the pillar of the total medical care which is available in the world today. Thus, nurses are at the forefront of global healthcare. They provide individualized patient care. They also educate, innovate, and advocate for the health and well-being of whole communities, whether it is an international setting or in their own background. The globalization of healthcare creates an increasingly interconnected workforce spanning international boundaries, systems, structures, and processes to provide care to and to improve the health of people around the world. Because nurses comprise a large sector of global health workforce, they are called upon to provide a significant portion of nursing and healthcare, and thus play an integral role in the global healthcare economy. By thinking globally, nursing fraternity have the power to move mountains. The way nursing professionals work during COVID-19 pandemic is commendable. However, the COVID-19 has exposed weaknesses caused by underinvestment in health system around the world. But let me tell you, ours was the one country which fought the battle of COVID-19 most effectively. And you know, how could we achieve this, the effective fight? Because of undented 24/7 support, dedication, and involvement of nursing care. India had the best recovery rate. India has the lowest mortality rate. Our vaccination program was the best. We have achieved the great level of herd immunity, and all this has been possible by 24/7 most dedicated participation by our nursing fraternity. There is an urgent need to invest in nursing, to build a resilient, highly qualified nursing workforce, and to protect nurses' rights in order to transform health system to meet the need of individuals and communities now and into the future. There is a need to allocate resources to educate more nurses and expand their scope of practice to meet the global demand and provide health equity across the population. It is also imperative that since the nurses are key stakeholder in any health system, they therefore should be given more roles in policy development and leadership. Just like your NSC had said, that there should be very importantly participation by nursing fraternity in policy making. I congratulate all of you for your efforts par excellence during COVID times as well as earlier also, all across the globe, and wish you all the best for future. Here, I would like to reassure your INC head that whatever constructive proposal is brought to the University of Health Sciences in Rajasthan, I would request our team to give me all the best proposals for creation of the cadre, starting new course, improving the nursing care, better producing the quality of nursing trained people, improving the practical training, improving the educational material, whatever they look forward, I will be very happy to provide every possible support to uplift the nursing education, nursing training, and the standard of nursing, who are the pillars of the healthcare system. I reassure you, sir, that RUHS will never leave any stone unturned, and whatever proposal is brought to me, probably rest assured, I will ensure that it gets approved, and the best of the nursing here, best of the support to the nursing fraternity is provided by university. I, in my personal capacity, would also like to invite Mr. Dilip, the INC head, to visit RUHS, to visit Jaipur, and I'll request Mr. Jogendra ji to organize a big program of Mr. Dilip, who will be very happy to interact with, and we would invite his suggestion to improve the standards of everything related to nursing in the state of Rajasthan, and we would like to be the role model of the best nursing state in the country. Thank you very much, and I'm humbled and honored for having invited me. I'm deeply gratitude expressed for using such kind words for me, and I'm always at your disposal, always everything what you look forward, I'll be happy to provide all kind of support. Thank you very much.
Thank you, sir. Thank you very much for the precious time you spent for the nurses. Now, this is the time to unfolding theme. And for unfolding theme, before the theme unfolded, I want to ensure that Dr. Vatsala will be with us in this session.
Yes, Mrs. Mamta, I'm here.
Okay, ma'am. So, ma'am, thank you very much for joining us. There is a little different theme is attributed to International Nurses Day every year. We would recommend taking a look at the theme, as this will give you a better understanding of the focus and could even help you to decide what you are going to do to celebrate International Nurses Day. The theme was designed to focus the real value that nurses bring to people all over the globe. A lot of major organizations around the world that embrace this date will use the theme to guide their celebrations and activities. So I'm proud privileged to having with us Dr. Vatsala Sadan from CMC Vellore. Madam is dean there in CMC Vellore, and Madam has PhD degree in nursing, MSc also in medical surgical nursing. Madam has a long professional experience. She started the job as a staff nurse in 1984 CMC Vellore. Till today, he is acting as a dean in CMC Vellore. Madam, if you permit me, I recite a shlok for you. Vidya vivadaye dhanam madaye shakti paresham paripidanaye khalashya sador viprit medad jnanaye danaye cha rakshanaye. The mischiefs use their education for conflicts, money for intoxication, and power for oppressing others. Honest one use it for knowledge, charity, and protecting others respectively. So over to you, Dr. Vatsala.
Good evening.
Good evening, ma'am.
Respected Dr. Sudhir Bandari, Vice Chancellor, RUHS, SMS Medical College, Dr. T. Dilip Kumar, President, Indian Nursing Council, Dr. Gupta, Senior Professor, SMS Medical College, Dr. Narottam Sharma, CMHO, Jaipur, Dr. Dharmesh Sharma, Associate Professor, SMS Medical College, Jaipur, Mrs. Anna Rajan, State Midwifery Consultant, UNFPA, Dr. Jogendra Sharma, President, TNA, and Mrs. Samta Soni. I am so delighted and happy to join and celebrate along with the nurses from Rajasthan. And I find around 600 nurses who have joined this webinar. And this is a real joyous occasion. And this is a special occasion for me to celebrate along with you all the International Nurses Day 2022. As it is repeatedly said, the theme for this year is Nurses, a Voice to Lead, Invest in Nursing, and Respect Rights to Secure Global Health. As everybody mentioned, during COVID-19 pandemic, nurses across the world worked tirelessly to prevent deaths against hearts. In India, nurses and other frontline workers were hailed as COVID warriors. due to their service and in the most testing times. However, the pandemic also gave us an opportunity globally and in India. It brought in the important thing, many challenges what the nurses faced in different occasions, in different situations, and also the shortage of nurses globally as well as in our country. And the ICN has said it's a serious threat to public health, and this shortage of nurses should be addressed at the earliest. Despite working through challenging circumstances, nursing staff continue to go above and beyond to deliver highly skilled, safe care to our patients every single day. The International Nurses Day theme focuses on the need to protect, support, and invest in the nursing profession to strengthen the health system in our country. And the president of ICN in the triad meeting during the past 3 days, she was highlighting from birth to death, non-communicable diseases to infectious disease, mental health to chronic conditions, in different settings, hospitals, community, industries, schools, homes, the nurses provide accessible, affordable, person-centered, and holistic care for all. And Howard Cotton, the chief executive of the ICN, told to the Nursing Times, the pandemic has shown us very clearly, in order to secure global health, the real investment has to be on nursing profession. And he has also added, nurses' rights, safety, and well-being must be protected. Dr. Dilip, in his speech, he addressed about this celebration of 2020, the International Year of Nurses and Midwives. As he rightly said, none of the other professions have celebrated like this. WHO and ICN has given International Year of Nurses and Midwives, and we celebrated across the globe, and we looked into our profession and we started looking at the futuristic role and responsibilities of nurses in all our regions, countries, and across the globe. And out of this International Nurses and Midwives Year, which was celebrated in view of 200th birthday of Miss Florence Nightingale, brought in many new lights and new visions for the profession. And Dr. Dilip was mentioning about the strategic directions for nursing and midwifery, and also that strategic directions also focus strengthening the nursing workforce to deliver the sustainable development goals, improve the health for all, and strengthen primary healthcare workforce on our journey towards achieving universal health coverage. Nurses take a central contribution to national and global targets related to the health priorities, which include universal health coverage, mental health, non-communicable diseases, emergency preparedness and response, patient safety, and delivery of integrated and patient-centered care. No agenda can be realized without concerted, sustained efforts to maximize the contributions of nursing workforce with interprofessional teams. Recently, I was sitting in a meeting in our institution along with our medical fraternity. And it was said, there can be a new hospital, there can be many beds, there can be many doctors appointed, but without nurses, we cannot run a hospital. It is very true that nursing workforce is very important, and nurses play a very important role and responsibility in the healthcare system of our country. As Dr. Dilip Kumar mentioned, I would like to take you through quickly few slides which talk about the nursing workforce, which are very important. And the nursing workforce is expanding in size and in professional scope. And it is said the global strategic directions for nursing and midwifery 2021 and 25, the SDN articulates a set of policy priorities in 4 key areas: education, jobs, leadership, and service delivery. Just give me 2 minutes just to share my slide, which talks about this strategic directions for nursing and midwifery development. And so this is an overview of strategic directions for nursing and midwifery report 2021 to 2025. As Dr. Dilip mentioned, there are 3 reports. One is the state of world's nursing, which was brought out, and he gave the history of 2020. And another one is the world's state of world's midwifery report, that is 2021. And from those, the global strategic directions for nursing and midwifery developed. And the strategic directions for nursing and midwifery 2021 to 25 presents evidence-based practices and an interrelated set of policy priorities that can help countries to ensure that nurses and midwives. Can you give me some time? There's something wrong with the slide.
Ma'am, there is a problem in your presentation.
Just give me some time. I'll just.
Yes, ma'am. Yes, ma'am. Ma'am, pen is on in your presentation. Pen is on. Kindly off the pen. Till then, Madam will correct the presentation. I want to mention that we have 3,800 registration all over this webinar. 600 is joined here.
Samta,
yes, ma'am.
Samta, I think somebody else is doing something on my slides. Can you tell them to stop it?
Yes, ma'am. I will check it out.
Because on my slides,
Yes, ma'am. Yeah, I will check it out.
Yeah, somebody is doing. Can you please stop them doing that? I thought it is from my side, but it is not from my side. I checked it.
Ma'am, kindly check your pen is on. In presentation, your pen is on.
Yeah, now it is fine.
Pen. Yeah, this is fine now.
Yeah, can you see?
Ma'am, I want to interrupt you. We have 3,800 of viewers right now. More than 500 here, and rest of the others are joined on FB and YouTube. So we have about 4,000 viewers. Yes, ma'am. Go ahead, please.
Yeah. Okay. So I will go on to the next slide. So the strategic directions for nursing and midwifery is for a period of 5 years. And as Dr. Dilip said, evidences from all the 7 WHO regions and from all the countries were collected, and an interrelated set of policy priorities that can help countries to ensure that nurses and midwives optimally contribute to achieving universal health coverage and other population-related health goals. And why this strategic directions for nursing and midwifery? The main purpose is to help countries ensure that nurses and midwives maximally contribute to achieve population health goals. And the primary target is health workforce partners and policymakers and key stakeholders across the country. As Dr. Dilip mentioned, there are 4 important areas which are highlighted in the strategic directions for nursing and midwifery development in the country. And these are education, job, leadership, and service delivery. And these 4 strategic directions are, the first one is educating enough nurses and midwives with competencies to meet population health needs. And the second strategy is creating jobs, managing migration and recruiting and retaining midwives and nurses where they are most needed. And the third strategy is strengthening nursing and midwifery leadership throughout health and academic systems. And the last direction is ensuring nurses and midwives are supported, respected, protected, motivated, and equipped to safely and optimally contribute in their service delivery settings. Our International Day theme goes with this. The nurses need to be respected, supported, protected, motivated, and equipped to safely and optimally contribute in their service delivery settings. I'm so glad to hear from your Vice Chancellor, giving a lot of motivation, support for all of you in your state. So I'm so delighted to have, hear from Dr. Sudhir Bandari. Sir, thank you very much for all the support you have entrusted to provide for our nurses in Rajasthan. And when you say education, I have divided into three. We have the evidences which are collected from different countries and the strategic directions and the policy priorities. When you say education, the evidences are we have various levels of program with varying quality and which are unaligned with competencies. And I should really commend and appreciate the Indian Nursing Council at this time for developing a new revised BSc nursing syllabus, which is a competency-based curriculum, and also the nurse practitioner programs, which are competency-based, and it is very futuristic thoughts are put in line with the best practices which are followed in the among the nursing universities across the globe. And insufficient number of graduates and preparation of faculty. We do agree we don't have enough graduates or nurses produced, or we do say that there are shortage of nurses in the country. But when we say shortage of nurses, people ask, where is the evidence? So do we have evidence for that? As Dr. Dilip said, he talked about the registration, the national registration tracking system. So at this time, I would also like to reiterate on that. All nurses need to register yourself so that the country have an account of how much of nursing workforce we have to serve the country, keeping in mind the migration of nurses within country as well as across the globe. And also the preparation of faculty. Preparation of faculty in implementing the curriculum is very important. Even if we have a fantastic, very good curriculum, competency-based, unless it is implemented, we cannot prepare nurses who are competent enough to serve the population of our country. So implementation is very important. Then the limited data reporting, as I mentioned, and COVID-19 also has brought to light many things and existing priorities for nursing and midwifery. These are the evidences. So with this evidences, the policy priorities are put on the right side, align all the levels of nursing and midwifery education with optimized roles within the health and academic system. So the Ministry of Health, Government of India, and the Indian Nursing Council have already identified which all should be the levels of nursing, how each level should be bridged, and what are the different roles for which we can prepare our nurses within the health and academic systems. So we need to put in all this into practice, and these are some of the important agenda policies which are taken with regard to education. Then optimize the domestic production of nursing and nurses and midwives to meet the demand of the health system. And what is the need? We follow the SIU norms, for the hospitals, as well as the INC has clearly said the norms for staffing for the schools and colleges of nursing. So we need to have adequate number of nurses and midwives prepared to meet the demand of the health system. How? So the policy priorities need to be put in to address this. Design competency-based educational programs which align with the quality standards as well as align with the population's health needs. Ensure that the faculty are properly trained with demonstrated in clinical expertise in the content areas. Many times we find the teachers sticking on to the colleges alone and they don't go to the clinical area. We need to take the theory to the classroom, to the clinical area, and from the clinical area, take the patient scenario to the classroom so that the students, are well prepared to meet the demands of our patients. And the second important key area to be addressed under the strategic directions for nursing and midwifery development is jobs. The evidences are, it is true that we have shortage of nurses, and it is there is maldistribution. We find more of nursing schools and colleges in South India, and in North India we find less. And even the filling of seats of nurses in most of the schools and colleges, there is maldistribution. And in some of the states, in some of the hospitals, we don't find adequate number of nurses appointed, not available. Even we have started facing challenges in CMC Vellore, because we have expanded so much. We have increased to 4,500 beds, and we find it very difficult to get nurses recruited nowadays. And it is a difficulty. And we also face challenges with international migration and mobility of nurses. And then recruitment and appropriate recruitment and retention policy should be put on place. And there is limited data reporting, and data for management and forecasting is not available. And hence, the policy priorities related to jobs should be conduct nursing and midwifery workforces planning and forecasting through a health labor market lens. If you read these reports of status of nursing in the world, as well as the midwifery, if you read those documents, you will find the health labor market lens, and ensure adequate demands or jobs with respect to health service delivery for primary health care and other population health priorities. And the next priority should be reinforce implementation of WHO's global code of practice on the international recruitment of health personnel. And also we should have strategies and policies to attract, recruit, and retain nurses and midwives where they are most needed. So these are the policy priorities with regard to jobs in order to increase the availability of nursing workforce by sustainably creating nursing and midwifery jobs, effectively recruiting and retaining midwives, and ethically managing international mobility and migration. The third direction would be leadership. We know, as we talk to the nurse leaders, they will say, in my state, there are positions, but the positions are not filled. There is gender bias. I do read in the chat box, please take care of male nurses. Please, improve. Many in the chat box, I read many such, comments. A lack of input in health policy decision making, and few nursing leadership positions are available at state level as well as in the country level, and limited opportunities for development. And again, limited data and data for management and forecasting. And the policy priorities would be to address this leadership issues would be establish and strengthen senior leadership positions for nursing and midwifery workforce governance and management and input into health policy. And we nurse leaders should be on the policy table wherever it is, because we only can understand the challenges we face as nurses, and we should be able to put forth what we want for the development of nursing and midwifery. It is our profession. So we should be on the policy table representing everywhere. And not only we also should see wherever you are, whether you are in the institutional level, in a hospital or in a college or in a state level or in an association, whichever leadership position you hold, you make sure that you invest in leadership skills, develop the next generation, the next level of nurses and midwives to take up leadership, in future. So investing in leadership skills again is very important. And also, I did listen to the ICN president's, address on this International Nurses Day. And she has mentioned that investing on nursing workforce ultimately improves the economic growth of a country. And she has challenged, it will definitely contribute to quality education, quality service without compromising the patient safety, ultimately improves the economic growth of the country. And the fourth key area is service delivery. The evidences are effectiveness of nursing and midwifery delivered care. And Dr. Dilip was talking about the nurse practitioner program. We do have the midwifery nurse practitioner program, and we do have some more nurse practitioners program in the pipeline. So we need to prove nurse-led models are effective, like other countries they have implemented already. So effectiveness of nursing and midwifery delivered care is an important area, should be addressed. And the scope of practice restrictions, now for every new curriculum which is rolled out, carefully the scope of practice is put down for approval. So we do face challenges with scope of practice restrictions, which need to be addressed. And the regulations need to be updated every now and then, because we have to run or walk in line with the changes in the society, changes in the science and technology, and even the disease pattern changes, and need for enabling work environments that support optimized service delivery by midwives. So midwife-led care, nurse-led delivery models, nurse-led primary care models. There are many evidences in other countries available to prove that the nurse-delivered care are as effective as the other healthcare services provided. The policy priorities in this area are review and strengthen professional regularity systems and support capacity building of regulators where needed, adapt workplaces to enable nurses and midwives to maximally contribute to service delivery in interdisciplinary healthcare teams. Nurses and midwives work to the fullest extent of their education and training in safe and supportive service delivery environments. It is in our hands. Each one of us who are seated here, listening to my address, it is very important that we play a very important role. We have to prove ourselves. We have to prove ourselves to our colleagues, to our human population, that nurses and midwives are working to the fullest extent of their education for which they are trained in a safe and supportive service delivery environments. And when you look at the SDNM 2021-25, there is a theory of change which is followed. So there should be broad engagement. All of us should hold hands together. It is not only the government's responsibility. It is not only TNI's responsibility. It is not only the private sector's responsibility. All of us should hold together, engage in this, focusing on this strategic direction for nursing and midwifery development, for which we need evidences to give it to the government or to put policies, brought in and put in action. We need data and evidences. So as Dr. Dilip said, we need to have every year the country is supposed to be giving health workforce account. So from where do we get? We have to have proper data which are, provided to the government of India in order to give to ICN. And then we need to have dialogue among ourselves, and then make a decision what we want, what strategies we want for the future development of nursing and midwifery in our country. Then the policy priorities can be addressed and policy action can be taken. There can be different ways by which the policy, priorities can be addressed. As one, Dr. Dilip said, we can even talk to the parliamentarians in your own places. Now our Vice Chancellor has, promised and he has assured us he will be there to support us. Like that, in your own states, the leaders in, in different levels, they should be with us, for prioritizing the policies and taking into, action. And keeping in mind, as Dr. Dilip said, there are sustainable development goals, and our ultimate goal is to achieve universal health coverage. And monitoring and reporting is very important. As I said, National Health Workforce Account, every year we are supposed to submit the annual report. Our government is supposed to submit. So we need, unless we give data, how many hospitals are there in your state, how many nurses are working, which levels of nurses, all those details, unless we give, we cannot compile that and give it to ICN. And the last slide is, it is a comprehensive slide which talks about all different strategic directions for nursing and midwifery, strategic directions for the next 5 years. And these are some of the highlights of the strategic directions for nursing and midwifery. So at this point, I would like to congratulate the Trained Nurses Association of Rajasthan. I'm really happy to see so many nurses joining and listening to this webinar. And the theme of the International Nurses Day demonstrates the need to invest in nursing, to build a resilient, highly qualified nursing workforce, and to protect nurses' rights in order to transform health systems to meet the needs of individuals and communities now and into the future. We as nursing fraternity should take action to maximize the contribution of nurses through optimizing the scope of practice and nurses' role in providing preventive and primary care. Let us look into positively managing the nurse migration, ensuring the quality of education provided, and investing in retention of nurses, especially in the needy areas, underserved areas. Let us be instrumental in getting an accurate count of nursing workforce in the country and engage nursing leaders in health policy making and development of nursing leadership. Nurses, a voice to lead. Invest in nursing and respect rights to secure global health. Once again, I congratulate each one of you for all your achievements and contribution to the nursing profession and the health care of people of our country, especially the state of Rajasthan. Continue to excel in your service wherever you are and be a blessing to many more people around you. We are in a noble profession. I'm sure God will bless each one of us as we carry out our responsibilities for which we have taken up this profession. Once again, I congratulate each one of you. Happy Nurses Day. Happy nursing too. Thank you for the opportunity. I thank Dr. Dilip Kumar for inviting me and also the President of Trainers Association, Rajasthan branch, Dr. Jogendra Sharma, for giving this opportunity. Wish you all the good luck.
Thank you, Dr. Vatsala. Thank you very much for the theme unfolding. We appreciate your hard labor behind your presentation. So thank you very much once again. We have with us CMHO First Jaipur, Dr. Narottam Sharma. So just I want to ensure with the technical team from GCON Jaipur that kindly find out that Dr. Narottam Sharma is there with us. डॉक्टर नरोत्तम शर्मा, आप मीटिंग में हैं क्या? आप पार्टिसिपेंट्स, एक और अच्छी खबर मैं आपको बताना चाहती हूँ कि ऑल ओवर जहाँ पे भी ये राजस्थान भर में और नेशनल लेवल पे वेबिनार देखा जा रहा है, करीब 5000 लोग इसको फेसबुक और यूट्यूब पे लाइव देख रहे हैं। रजिस्ट्रेशन हमारे हुए थे करीब 5000, अबाउट 5000 थे, लेकिन फेसबुक और यूट्यूब पे लाइव चल रहा है। कुछ लोग यहाँ पे भी हैं, करीब 450 लोग यहाँ पे जुड़ रहे हैं, बाकी जो अदर हैं दे आर ऑन फेसबुक एंड यूट्यूब लाइव। डॉक्टर नरोत्तम शर्मा, आपको मेरी आवाज आ रही है? डॉक्टर नरोत्तम शर्मा,
मैंने ढूंढ लिया नरोत्तम सर ने और उनका डिस्प्ले नाम डिस्प्ले नाम हम बहुत देर से देख रहे हैं।
तो डिस्प्ले पे क्या नाम आ रहा है आपके? आवाज आ रही है सवारी पर हम तो पूरे वीडियो वगैरह बोलो ना, किस नाम से आ रहा है उस पे, आईडी किस नाम से? हाँ 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 हाँ, तो एक बार आपको देखो दीजिए, लिख रहा हूँ किस नाम से बनी हुई है।
हमारे बीच में हमारी होनहार छात्रा नीलू गुर्जर विद्यमान है और बहुत अच्छी पोयम पढ़ती है, बीएससी फर्स्ट ईयर की छात्रा है। नीलू गुर्जर से रिक्वेस्ट करती हूँ कि वो मीटिंग में है तो अपना माइक ऑन करें और पोयम पढ़ें। नीलू गुर्जर, यस यस, हाँ हाँ नीलू प्लीज।
Good morning, good afternoon all of respected principal sir, all teachers, all classmates and all seniors. Happy Nurses Day. गुजर है, मैं BSc नर्सिंग फर्स्ट ईयर स्टूडेंट फ्रॉम GCON जयपुर। जैसा कि आज आप सभी को पता है, हम यहाँ नर्सेस डे को मीटिंग में आए हैं। एक नर्स जो अपना सेवा करने में बिताती है। मैं आपको बताना चाहती हूँ कि नर्सिंग दुनिया का सबसे बड़ा सेवा में प्रोफेशन है, जो सेवा, कर्तव्य और निष्ठा से भरपूर है। लोग अपने पापों का प्रायश्चित करने के लिए और पुण्य कमाने के लिए मंदिर, मस्जिद और तीर्थ स्थल पर
राजस्थान के
हमारा तीर्थ स्थल है जहाँ हम हमारे मरीजों की सेवा करते हैं। मैं बहुत खुश होती हूँ और खुद पर बहुत ज्यादा प्राउड फील करती हूँ कि मैं इस करियर ऑप्शन का, इस प्रोफेशन का एक हिस्सा हूँ। लेकिन मुझे बहुत दुख होता है कि आज के समय में भी नर्सिंग एक बेस्ट करियर ऑप्शन होने के बाद भी कुछ लोग इसे दोयम दर्जे का मानते हैं। तो आज इसी मुद्दे पर मैं
हाँ जी, आवाज आ रही है आपको मेरी? हेलो
वेबिनार, यस वेलकम टू द वेबिनार। आपकी आवाज आ रही है?
हाँ मैम।
सर,
मैम
चंद पंक्तियां आपकी शान में मैं सुनाना चाहूंगी कि आप उससे पहले शुरू करें। आपका कोविड में मैंने काम पर्सनली देखा है, क्योंकि CMHO 1 में हम भी पोस्टेड थे कुछ दिनों के लिए। तो एक छोटी सी कविता है, 1 मिनट लगेगा। कवर में फंसे हुए थे, क्या हुआ हम डूबे नहीं, ठहरे हुए हैं। घर घर के बाहर के दरवाजे पर ताले नहीं, पहरे पड़े हुए हैं। दरिया फिर भी समतल होगा, हम फिर उभर कर निकलेंगे। भयानक इस बवंडर से हम फिर तैर कर निकलेंगे। छलनी कर दिया तो क्या हुआ, कुछ पंखों के 2 पर ही तो थे। जान और जिगर सलामत है, हम हर पल आजमा कर बिताएंगे। गिरते गिरते उड़ेंगे, फिर दोबारा ये पर निकलेंगे। भयानक इस बवंडर से हम फिर तैर कर निकलेंगे। एक बात तो समझ आई है, क्या गुनाह था, क्या गलती थी। कुदरत अपनी जागीर नहीं, ये भ्रम हमने पाली हुई थी। जितना हम बाहर निकले उतने ही भीतर निकलेंगे। भयानक इस बवंडर से हम फिर तैर कर निकलेंगे। ओवर टू यू डॉक्टर नरोत्तम।
मैम बहुत तो आपको नर्सिंग दिवस की आप सभी बहुत बहुत शुभकामनाएं। जिस तरह से आप लोगों ने काम करते आ रहे हैं और काम कर रहे हैं, आप चिकित्सा जगत की एक रीढ़ की हड्डी हैं, जिसका महत्व कोई बता नहीं सकता। जिस तरह से आप लोग ने मेरे साथ कोविड में काम किया या राजस्थान में दिल्ली में काम किया, आम लोगों को जो राहत दी, वही एक बहुत बड़ा कारण रहा कि आज हम कोविड से निजात पाए। आप सबका मैं बहुत अभिनंदन करता हूँ। आप कर रहे हैं, आप जो लोगों को आप अपना जिस तरह से आप अपनी सर्विस सब लोगों को दे रहे हैं, मैं निश्चित तौर से कहना चाहूंगा कि आप लोग कोई मतलब कोई बराबरी नहीं हो सकती है। मैं पुनः आप सबको बहुत बहुत साधुवाद और धन्यवाद देना चाहूंगा कि आपने चिकित्सा जगत का मान बढ़ाया है। आप ऐसी एक चिकित्सा की एक मेन कड़ी है जिसके बिना चिकित्सा आगे नहीं बढ़ सकता। और आपको बहुत शुभकामनाएं, बहुत बहुत धन्यवाद।
आपके शब्दों से गागर में सागर बराबर प्रतीत होता है सर। थैंक यू वेरी मच। और आप ड्राइव में हैं, ट्रैवल कर रहे हैं शायद। सॉरी हमने आपको डिस्टर्ब किया, बट आपके शब्द हमारे लिए प्रेशियस थे और सलामती की दुआ करते हैं। थैंक यू वेरी मच फॉर द टाइम यू स्पेंड विद अस।
थैंक यू।
हमारे साइंटिफिक सेशन का फर्स्ट लेक्चर अभी शुरू होने वाला है और मैं डॉक्टर कमलेश लाल चंदानी को इनवाइट करती हूँ इस सेशन फर्स्ट सेशन लेने के लिए। उनका सेशन है रेस्पेक्ट नर्सेज राइट्स, प्रमोट क्वालिटी ऑफ केयर। Dr. Kamlesh Lal Chandani is a public health professional with over 15 years of experience. Currently, he is Director Program and Operations in Jhpiego, India, managing multi-pronged project with various stakeholders, including the government, donors, and funding organizations and professionals organizations. He is passionate advocate for human resource for health, maternal and newborn health, and family planning. He is leading Jhpiego's nursing midwifery portfolio in India and closely work with the Ministry of Health and Family Welfare. The Indian Nursing Council is in establishing and implementing short and long-term goals and objective for nursing midwifery and transforming maternal and neonatal healthcare in India. Dr. Kamlesh holds a master's in community medicine and his bachelor's degree in medicine from MP Shah Medical College, Jamnagar, Gujarat. Dr. Kamlesh, over to you.
Thank you, Dr. Samta, and thank you all for, and first of all, Happy Nurses Day to all. And as Dr. Dilip Kumar sir told, nurses is close to and very touchy subject to Jhpiego. And let me tell you, I don't know, you all know Jhpiego. Jhpiego is an international organization with affiliate with the Johns Hopkins University. And as sir said, nurses is very close to our heart. Everyone in the Jhpiego, our CEO is nurse, so it's a great pleasure for us that, and even in Jhpiego, we have almost 40 to 50% staffs are being nurses. So, and since more than a decade, we are working, closely working with the Indian Nursing Council and Ministry to improve the standing the nursing education in the country. So I thank you, DNI as well as Indian Nursing Council for inviting us for this webinar. And it's an important day for us. And I can see the importance directly from, I just wanted to quote my speech. I want to start with a quote from our Prime Minister Narendra Modi ji. Again, he has tweeted that nurses play a vital role in keeping our planet healthy. Their dedication and compensation is extremely International Nursing Day to reiterate our appreciation to all nursing staff for their exceptional work, even in the most challenging situation. And these words are coming from our highest and Prime Minister from India. So you can understand that how currently the nursing professional is recognized from all over the world. And all of us have shown, I think all of my previous speakers has talked about contribution of nurses in the COVID pandemic, right? So doctors ne to role play kiya tha, but simultaneously nurses who has played critical role 24/7 across India, and this has been recognized at all level, including our Prime Minister. So I think we can see these changes if you compare to earlier years where nursing professionals were not recognized, not respected, because currently my topic is to respect nurses' right. So when we talk about the respect, currently the level of nurses, professionals and nursing cadre opportunities, it's changing, and it's good that this change is happening. So I want to thank the organizer for giving this opportunity. As far as rights is concerned, I don't know about, I don't want to have the specific, but if you want and if you see globally how nursing professions are working across US, across UK or other countries where the strong nursing cadre is there in India. So what they want, it's primarily, and I think Dr. Vatsala has also touched upon, that nurses should have right to practice. They should have the enabling environment. When we say enabling environment, we see in the many working conditions in the government hospitals or in the faraway places, they don't have facilities to work. So primarily to ensure that they should have that enabling environment to work, they should have their safety for the work, because currently also we see when any untoward reaction happening at the facility level, entire burden and entire blame comes on the nursing professionals, and violence is happening across the India. So this should be protected, nurses should be protected, nurses should be respected what they are doing. And we know we have acute shortage of doctors. Even if you saw currently the health service delivery, almost 80 to 90% of deliveries are being conducted by nurses. And now in India, if you see, almost 90% deliveries are happening at the institute level, right? And out of them, 80 to 90% deliveries are being conducted by the nurses. So this is the way see the importance of the nursing cadre in the system. So we should provide them enabling environment. We should provide them fair compensation. Again, if you see the disparity of the salary between the public sector and the private sector, and also I was seeing some of the chats, there are still there are issues of the gender discrimination, there are issues of the working condition, there are issues of the creation of the regular post. That's again a very critical thing, because currently we see many positions are being nursing cadre are being contractual. How we can do collectively do that? Okay, see, to create those positions. So those are the things which will change nursing scenario in the country, and this will create a respect. When it comes to quality, again, for quality of care, we should start investing from the pre-service level. We should not say that once the nursing professionals are coming in the service, then we should start investing. And there's the vision, I think, which Indian Nursing Council had 1 decade back in 2009-10. In close coordination with the Indian Nursing Council, we started strengthening the pre-service nursing education. So primarily strengthening the A&M school, GNM school, BSc Nursing College, where we came up with some of the quality standards. And we implemented that at the pre-service nursing education level. And I think these are being adopted by Nursing Council, and many states are doing on their own. So when we talk about quality, we should start investing from the pre-service level, not to wait at the in-service level. And I will highly recommend, I think these standards and these quality parameters are available in the INC website. You should look into that. All the colleges, particularly the faculties who are there participating in this webinar, they should see how it can be done, how we can improve the quality. When it comes to in-service also, quality is directly linked with to the kind of environment you are creating. Because if you are not giving that kind of infrastructure, supplies, logistic, human resource, then you don't expect quality services from all the cadres. If that you have 1 or 2 staff nurses and they are conducting 24/7, 10 deliveries, 15 deliveries in a month, and then we expect that quality, it's not possible. And we compare that with the private facilities. So that's also not. So first, to ensure the quality, we have to strengthen the infrastructure. We need to create the positions. So there is a direct linkage. When we say that we have to respect the rights, again, if we start respecting, respecting all these rights, creating that environment, and that is directly proportionate to the quality of care. So yeah, I would just want to end my thoughts and my speech with that notes. So let's start investing in the quality. And again, I would emphasize we should start investing from the pre-service level. And that's a critical thing which we can, all of us can do. Again, thank you organizer, and thank you Indian Nursing Council for giving JAPIGO this opportunity. Thanks a lot.
Thank you, sir. Repeatedly, I'm talking with you, and you always said that I am in travel. So we are sorry in case of any inconvenience caused by our invitation. Thank you very much for sparing time for TNI Rajasthan State Branch. Now we are going for the second session of this webinar. I would like to invite Dr. I.D. Gupta. Or sir, I want to recite the poem for you. सफर में धूप होगी जो चल सको तो चलो, सभी हैं भीड़ में तुम भी निकल सको तो चलो, किसी के वास्ते राहें कहाँ बदलती हैं, तुम अपने आप को खुद ही बदल सको तो चलो, यहाँ किसी को कोई रास्ता नहीं देता, मुझे गिरा के अगर तुम संभल सको तो चलो, कहीं नहीं कोई सूरज धुआं धुआं है फजा, खुद अपने आप से बाहर निकल सको तो चलो, यही है जिंदगी कुछ ख्वाब चंद उम्मीदें, इन्हीं खिलौनों से तुम भी बहल सको तो चलो. Dr. I.D. Gupta, Senior Professor, Department of Psychiatry, Medical College, SMS Medical College. I over to you, Dr. I.D. Gupta, for the session Mindfulness and Mental Health. Yeah. I request technical team to share the PPT of Dr. I.D. Gupta.
You are hearing me?
Yes, sir. Audible? Your voice, yes, sir, audible. Yeah. And your PPT is also, I hope you are visible.
Yeah. I congratulate all the participants for the International Nursing Day and dignitaries, Vice Chancellor Dr. Sudhir Bhandari sir, T. Dilip Kumar sir, Dr. Walthama, Dr. Kamlesh, Dean, Dr. Jogendra ji, Dr. Samta, and other all-line participants. I would like to add 2 things only. Number 1, all nurses, all medical professionals are health ambassadors. So it's a teamwork, not individual person. Number 1, we have only one religion. Hamara dharma, health. Health is our religion. And our motto to serve the humanity. So we have to work for the humanity. We are doing in the pandemic and as well as before pandemic and after pandemic, we have to do. Our previous speakers spoken very well. And mindfulness is the topic selected because this is the need of today. Need of today in medical professional is more. So training of the persons himself and training of the students that can maintain that their cool calmness and how we can develop ourselves in better way. Mindfulness, it means moment to moment. It's a habit. Sometimes more one does, more likely one to be the more and less efforts. It's a skill we have to learn. So moment to moment experience at one time and assessing something we already have. So mindfulness, we have to observe what we have in our present status and we have to follow accordingly. It's a habit. Sometimes more one does, the more likely one to be in the more that less efforts. And we can add that person gratitude compassion, empathy, we have to develop. Next. Next. Mindfulness is a human ability to fulfill the present, aware of where we are and where we are doing, not overly reactive, overwhelmed by the what's going on around us. Where two words are there. At present, what we are doing, what we are around us, and not reacting, not judgmental. So non-judgmental and non-reacting are the two components important for the mindfulness for your relaxation. Next. Mindfulness means paying attention in a particular way or for a purpose in the present moment or non-judgmentally. At present, what we are doing, आसपास क्या हो रहा है, क्या नहीं हो रहा है, आसपास की चीजों को छोड़ के प्रेजेंटली जो अपन कर रहे हैं, जो पर्पस है, उसको कंसंट्रेट करें, उसको अटेंशन करें. That is main mindfulness, to give the attention and focus on the purpose and cause and subject, so we can be the more useful to ourselves and our society or profession. Next. 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 Originally associated with the Buddhism, mindfulness, the term mindfulness comes from the Sanskrit word smriti. Smriti means remembered, and 2600 years back, it was found that it was related with the word, and remembrance is the one part that is usually found that how we can correlate with the present era, present situation, and that is more important. If we select for attention, focus, gratitude, empathy, they are the components that helps your rememorization and improves your skills as well as your working focus. Next. Auditory. Next. Next slide. But the goal of the main goal to wake up the inner working of our mental, emotional, and physical process. As we know, as a definition of your health by WHO, physical, mental, and social well-beings, or nowadays we are also added the spiritual health also. So to generate, to revive your mental and emotional feelings, physical process, because we know the emotional well-being is more important. And that is more part that we should improve our EQ. Medical profession, we are the persons, we have the better the IQ, but along with the IQ, we have the better EQ, emotional quotient. And that is the part that is required for the better empathy, to care of the others, to see the emotional strength and find out the reasons why we can develop our mindfulness. Next. Next. Why mindfulness? Because you are struggling with the feeling of your psychosomatic disorders, anxiety, depression, lack of concentration, lack of focus, lack of attentive part. So you feel distracted and you are not able to concentrate on one part. So you are stressed and your working, your professional part will be affected. So we have to find out that what is the biggest focus on the one point. You have to live around what is going on. The one focus is the only important part, and we can concentrate like in the TM meditation. We are thinking the thoughts are coming in the mind. बार बार विचार आते हैं, आने दीजिए, अपने को विचार आने दीजिए, अपने को एक फोकस, एक पॉइंट, एक मंत्र, एक चीज याद लाई जाती है, उसको अपनी याद करते रहते हैं और विचार आते रहते हैं. धीरे धीरे उनकी फोकस धीरे धीरे कम हो जाता है, and we concentrate on that part. For students, we usually tell them to improve your concentration. That helps in your memory improvement. Always give the TM meditation, or mindfulness is the like meditation. We have to focus on the same focus, same object, same point, so we can be more comfortable. Next. You have a hard time practicing self-compassion. You require the दूसरे के प्रति कैसे दयालु रहें, कैसे kindness develop करें. You have to struggle with the overreacting and excessive snacking. बेवजह की दूसरे के रिएक्ट नहीं करनी, बातचीत को अपने हम्बल सा अपना बिहेवियर रहना चाहिए, अननेसेसरी की उस चीज कर बातचीत पे निचोड़ नहीं निकालें। यू टेंड टू फोकस ऑन नेगेटिव इमोशंस, कोशिश करें कि नेगेटिव इमोशंस के ऊपर बहुत ज्यादा रिएक्ट नहीं करें, ओनली अपने पॉजिटिविटी जो है उस पर अपन ध्यान देना है। एंड योर रिलेशंस विद अदर्स आर नॉट एज गुड, सो दिस इज द मेन इंपॉर्टेंट पार्ट। रिलेशंस बहुत हेल्दी नहीं हो पाते हैं। टू डेवलप द प्रो सोशल बिहेवियर, दैट इज अ मोर इंपॉर्टेंट पार्ट। वी हैव सीन द mainly in our pandemic, the pro-social behavior of the students and children's adolescents age group, that was excellent, and that developed for the future strength of the emotional strengthening with the family members and family bonding. Next. Three key features are there. Purpose mindfulness involve the intensely and purposefully directing your attention, mainly purposefully and intensely, and you have to avoid the wandering thought process. So this is the basic purpose of mindfulness. Presence is mindfulness involves being fully engaged with attentive to the present moment. आपको सिर्फ उसी पॉइंट पर ध्यान देना, आसपास के ऊपर ध्यान नहीं देना है। And thoughts about the past and future that arises are recognized simply as thoughts occurring as the present. आसपास जो विचार आ रहे हैं उन पर ध्यान नहीं देना, प्रेजेंट में जो विचार आ रहे हैं वो याद रखना है। And acceptance, you have to accept the non-judgmental towards whatever the present situation, like sensation, thoughts and emotions, not just as अच्छा है, बुरा है, pleasant है, unpleasant है, simply happening जो हो रहा है उसको accept करना है। तो these are the three parts. Next.
Please wait for 1 minute. So please wait for 1 minute. We are.
Yeah.
नेट नहीं मिल रहा उधर, उनका नेट नहीं मिल रहा, उनका तो सबको बैठे
Without slide I can speak. Ma'am.
Sir, we are trying to reshare. Some net problem is there, so please wait for 1 minute.
Without slide I can speak.
Yeah, sir, you can speak.
Okay. So I'm coming that what the benefits of the.
The slides are there. So slides are there.
Okay. Next slide. Acceptance is a mindful involved being non-judgmental towards whatever arises in the mind. This means that sensation, thoughts, and emotions are not judged as good and bad, pleasant or unpleasant. They are simply noticed as a happening and observed until they eventually pass. So we have to observe on the acceptance of the thought process within non-judgmental and non-reactive. Yeah. Next. So benefits of the psychological part we can say of the mindfulness: psychological, spiritual, and physiological. So there are the three types of benefits we can say. The benefits by the psychological aspects, cognitive aspects, physiological, and spiritual also. In the psychological aspects, we say that there is an increase of happiness is there, increase of compassion is there, satisfaction of the life, relationships quality will be improved, work satisfaction will be improved, sense of meaning will be improved, and stress will be decreased, as well as the depression and anxiety will be decreased. Boost of working memory, focus, attention, and suppress the distraction of the person. Less emotional reactivity will be there. Next. Physiologically, we can say immune response will be improved. There are chronic pain and hypertension will be decreased. enhance epigenetic regulations, cardiovascular factors, decrease cortisol, that is a stress hormone. It will be better sleep quality. There will be cortical thickening that is responsible for the attention, and we found in the fMRI. We can say that neuroplasticity will be improved and enhance the neural interconnections by the increase the white matter by the interconnections. We can say greater resistance to stress-related illness such as heart disease. We can say, right? Next. Increased awareness of one's mind, significantly reduce stress, anxiety, already we have discussed. Increase mental flexibility. As a normal person, we require who is a healthy mental person? The person who can be more flexible at the moment and mentally stable, that is the normal person. We can improve the working memory of the person, decrease distractible thoughts and emotional reactivity, already we discussed, and the intentionally responsive behavior that improve the resilience in the children as well as the kindness in the adults. Next. Spiritual benefits, the increase self-insight and self-acceptance. Fear modulation is there. Increase the morality and intuition. Increase empathy and increase control over autonomic behavior and self-discipline. That is more important in all students and the nursing as well as the health ambassadors. That is a very important part of your schedule. Next. Type of mindfulness, body scan meditation, breathing meditation, loving kindness, observing thought meditation. In body scan, we can concentrate on your body parts. In breathing meditation, you can concentrate on your breathing. सांस अंदर जा रहा है, सांस बाहर जा रहा है. सांस लेते वक्त सोचें सारी ऊर्जा सारे शरीर में जा रही है, सारी शक्ति जा रही है, सारी पॉजिटिविटी जा रही है. सांस बाहर निकल रहा है, इसका मतलब नेगेटिविटी बाहर निकल रही है, स्लीप डिप्राइवेशन बाहर निकल रहा है. लविंग काइंडनेस, जो भी आपके लविंग ऑब्जेक्ट्स हैं, पर्सन्स हैं, उनको याद करके मेडिटेट करें. एंड ऑब्जर्विंग थॉट मेडिटेशन, जो विचार अपने को दिया गया है, जो मंत्र अपने को दिया गया है, उसको लेके ऑब्जर्व माइंडफुलनेस डेवलप करें. तो ये 4 तरह के मेडिटेशन अपन कर सकते हैं. There are different type of therapies recommended: acceptance and commitment therapy, delicate behavior therapy, mindfulness based art therapy, mindfulness based cognitive therapy are working in our department also. Mindfulness based pain management, we focus on the pain or chronic pain persons, and mindfulness based stress reduction, how to reduce the reduction. This is the most popular therapy we are using in day-to-day life for the students, for the faculty, for the groups, for the some NGOs. So how we can do? Basic mindfulness stop means temporary stop whatever ideas coming in your mind and focus on your attention at present moment. So moment to moment experience of their own activities, that is important. Take 3 deep, slow and deep breathing that helps in meditation, and observe and label any sounds around you. आस के आसपास पंखा चल रहा है, कोई अपने अच्छा आदमी खड़ा हुआ है, कोई बात कर रहा है, नियर बाई को अपन याद करें. And proceed with the whatever you are doing with a smile. Always, कभी भी मुस्कुराने में और तारीफ करने में कोई कंजूसी नहीं करें. Give pleasure, get pleasure. This is a basic principle of your mindfulness. Next. So effect of meditation on therapist and trainees also, it improves the empathy as well as the compassion, improve the counseling skills as well as the decrease the psychosomatic disorders. Next. When we divide the formal and informal mindfulness, enjoying life, enrich optimism and hope, challenging negative thinking, thought mindful learning. I would like say, सबसे बड़ा सुख निरोगी काया, जीने के लिए 5 दोस्तों का साया. So be hopeful, be optimistic, avoid the negative thoughts and give and take. जैसे अपने इमोशनल क्वेश्चन होता है, ऐसे स्पिरिचुअल क्वेश्चन में अपने मान के चलते हैं. जो थॉट्स में सोच रहा हूं, बुरा विचार ब्रह्मांड को जाता है, ब्रह्मांड से वो ऑब्जेक्ट को आता है और उसे महसूस होता है कि क्या चीज इंप्रूव होने वाली है, क्या चीज होने वाला है. तो इस तरह के थॉट्स को ऑप्टिमिज्म और होप के साथ हम बढ़ा सकते हैं. Enhance balancing and equity with the mindful movements and somatic awareness, practicing the gratitude and forgiveness, develop kare, enrich the kindness and compassion. They are the schedules we will discuss in the last slide. Next. Conclusion, we can say that restores the childlike behavior wonders, improves quality of sleep, supports working memory, reduce the stress, cognitive flexibility, may help lower blood pressure, improves cognition, decrease emotional reactivity. Or we can say we have the schedule 10 to 15 minutes per day, 4 to 6 weeks, we have to do this therapy. And we have to make the schedule, mindfulness schedule, Monday for the gratitude, Tuesday for compassion, Wednesday for acceptance, Thursday for meaning and purpose, Friday for forgiveness, Saturday for celebration, and Sunday for the reflection on day, month, or year through meditation or by prayers. We can say in the life, we are the professionals. Day-to-day life, we have to observe the stress in your professional life, your personal life, and social life. So mindfulness is the therapy. We have to observe ourselves. We can give the trainees. And when we give the trainee and therapist, both will get benefited by improving your empathy, social enrichment, compassion, improving your social skills, counseling skills, and reduce your stress level. Thank you very much. If anybody have any questions, put on your chat box. We'll respond you. Thank you very much. Thank you.
Thank you, sir. Can I say in one shlok, Asatoma Sadgamaya, Tamsoma Jyotirgamaya, Mrityurma Amritam Gamaya, is this mindfulness?
Thank
तो
you.
हमारी हिंदुस्तानी संस्कृति बहुत वर्षों से यूज कर रही है और आपकी जो फ्रूटफुल स्पीच आई होप कि सभी नर्सेस को वो समझ में भी आई होगी और they will start practicing mindfulness to restore their mental health. Thank you, sir. Thank you for sparing time. And we are sorry for inconvenience due to technological errors.
Thank you. Thank you.
I would like to invite our next speaker for this webinar, Dr. Dharmesh Sharma, who is Associate Professor, Preventive and Social Medicine, SMS Medical College, Jaipur. He is also National Trainer for Rashtriya Kishore Swasthya कार्यक्रम and Assistant Nodal Officer COVID Vaccination. Dr. Dharmesh Sharma, आपकी पर्सनालिटी को जितना मैंने जाना है, मैं उसको कविता में पिरो के आप सुनाना चाहती हूँ अपने पार्टिसिपेंट्स को भी। जिंदगी है छोटी, हर पल में खुश हूँ, काम में खुश हूँ, आराम में खुश हूँ, आज पनीर नहीं दाल में ही खुश हूँ, आज गाड़ी नहीं पैदल ही खुश हूँ, आज कोई नाराज है उसके इस अंदाज से ही खुश हूँ, जिसको देख नहीं सकता उसकी आवाज से ही खुश हूँ, जिसको पा नहीं सकता उसको सोच कर ही खुश हूँ, बीता हुआ कल जा चुका है उसकी मीठी याद में ही खुश हूँ, आने वाले कल का पता नहीं इंतजार में ही खुश हूँ, हंसता हुआ बीत रहा पल आज में ही खुश हूँ, जिंदगी है छोटी हर पल में खुश हूँ. Thank you, sir. Thank you so much for attending the webinar on a short notice. So over to you, Dr. Dharmesh. I request my technical team to share PPT of Dr. Dharmesh Sharma. Dr. Dharmesh Sharma, over to you. Dr. Dharmesh Sharma, over to you. Your presentation is on. Dr. Dharmesh Sharma, आपकी आवाज नहीं आ रही है.
नमस्ते
सर, मेरी कविता तो आपने सुनी ली होगी, मुझे लग रहा है आप नाउ यू आर ऑडिबल.
बहुत अच्छी कविता थी मैडम आपकी, थैंक यू. एंड ऑनरेबल सुधीर भंडारी सर, Vice Chancellor RUHS, respected Dilip Kumar sir, ID Gupta sir, Jogendra sir, and all other dignitaries present. सबसे पहले सबको हैप्पी नर्सेस डे। आज हम यहाँ ग्लोबल हेल्थ, पेंडेमिक्स और नर्सेस पर बात करने के लिए हैं। तो ग्लोबल हेल्थ विश्व स्तर पर कहीं भी कोई इवेंट होता है, उस इवेंट पूरे वर्ल्ड को प्रभावित करता है। ये हमने अभी कोविड पेंडेमिक्स में देखा है कि वुहान में हुआ एक छोटा सा इवेंट पूरे विश्व को इतना ज्यादा प्रभावित कर दिया कि लास्ट 2 इयर्स से हम सफर कर रहे हैं। लेकिन इस पेंडेमिक में जो ग्लोबल मेडिकल प्रोफेशनल्स हैं, चाहे वो डॉक्टर हो, नर्सिंग स्टाफ हो, पैरामेडिकल्स हो, हम लोगों ने जिस तरीके से काम किया और इस कोविड पर विजय प्राप्त की, उससे पूरे वर्ल्ड में मेडिकल प्रोफेशन का हिस्सेदारी बढ़ी है। नर्सेज की जब हम बात करते हैं तो नर्सेज हमारे लिए एक एसेट्स है। हेल्थ केयर के अंदर नर्सेज का दिस प्ले ए वेरी इंपॉर्टेंट एंड क्रिटिकल रोल इन हेल्थ प्रमोशन, प्रिवेंशन and delivery, primary and community care. They provide care in emergency settings and will be key to the achievement of universal health coverage. चाहे ICU में काम करना हो, वार्ड्स में काम करना हो, या नेशनल हेल्थ प्रोग्राम्स को ग्रास रूट लेवल पर इम्प्लीमेंट करना हो, नर्सेज ने जो काम अपनी जिंदगी को दांव पर लगा करके इस कोविड में किया है, और इस कोविड के पहले जो अपना प्रमोटिव, प्रिवेंटिव एंड क्यूरेटिव वर्क्स के अंदर जो काम है, इसी को देख करके WHO ने 2020 का जो WHO डे थीम था वो दिया द ईयर ऑफ द नर्सेज 2020। इतना बड़ा सम्मान जो नर्सिंग स्टाफ, नर्सिंग को दिया है WHO ने, इसके लिए नर्सेज बिल्कुल हकदार हैं। यदि हम हेल्थ कवरेज की बात करें, यूनिवर्सल हेल्थ कवरेज की बात करें, MDG की बात करें, SDG की बात करें, तो achieving health for all is depend on there being sufficient numbers of well-trained and educated, regulated and well-supported nurse and midwives who receives pay and recognition commensurate with the services and quality of care that they provide. Means एक निश्चित अनुपात के अंदर अगर नर्सिंग स्टाफ, नर्सिंग ऑफिसर्स एक अच्छे पे ग्रेड के साथ में अगर उन्हें मिलेगा तो वो बहुत अच्छे तरीके से काम कर पाएंगे और हम हमारे सारे जो टारगेट्स हैं उनको अचीव करेंगे। लेकिन जैसा दिलीप कुमार जी ने भी बताया था कि नर्सिंग प्रोफेशनल्स की काफी कमी है। नर्सिंग प्रोफेशनल्स को जो गवर्नमेंट सर्विस में या प्राइवेट सर्विसेज में जो पे दिया जा रहा है वो पे सम्मानजनक नहीं है, और यदि हम हमारे यूनिवर्सल हेल्थ कवरेज को अचीव करना चाहते हैं तो हमें ऑल मेडिकल प्रोफेशनल, चाहे डॉक्टर हो या नर्सिंग ऑफिसर्स हो, स्पेशली नर्सिंग्स को आपको वो रेस्पेक्ट देना ही पड़ेगा। ग्लोबल हेल्थ की जब हम बात करते हैं, ग्लोबल हेल्थ फॉर द हेल्थ इश्यूज that transcends national boundaries and governments and call for action on the global forces that determine the health of people. इसका मतलब है कि हेल्थ का कोई भी इश्यू जिसके लिए देश व सरकारों से परे विश्व स्तर पर कार्य करने की आवश्यकता हो और विश्व के नागरिकों के स्वास्थ्य का जिससे निर्धारण होता हो। जैसा मैंने अभी पहले बताया था कि पूरे वर्ल्ड में कहीं भी कोई इवेंट होता है तो वो पूरे वर्ल्ड को प्रभावित करता है, और दूसरे शब्दों में हम कहें अगर पूरे विश्व में एक भी अनसेफ पर्सन है तो पूरा विश्व सेफ नहीं रह सकता। इसलिए हमें विश्व बंधुत्व की भावना से काम करना पड़ेगा, पूरे वर्ल्ड के लिए सोच करके काम करना पड़ेगा। यहाँ कोविड के अंदर हमने देखा कि ग्लोबल हेल्थ पैंडेमिक ब्रेक्स द बाउंड्रीज, कि कोई भी आउटब्रेक जब वो बाउंड्रीज तोड़ता है स्टेट की, कंट्री की एंड कॉन्टिनेंट्स की, तो वो पैंडेमिक बन जाता है। लेकिन पैंडेमिक्स को कंट्रोल करने के लिए और हेल्थ को अचीव करने के लिए वी ऑल देयर शुड बी नो बाउंड्रीज इन द वर्ल्ड टू अचीव हेल्थ। हमको पूरे वर्ल्ड के अंदर जो बाउंड्रीज है उसको खत्म करना पड़ेगा, विश्व बंधुत्व की भावना से काम करना पड़ेगा। ग्लोबल हेल्थ के जो कंपोनेंट्स हैं कि विश्व में कहीं भी कोई हेल्थ इवेंट हो उस पर पूरे विश्व स्तर पर एक समझ होनी चाहिए, एक तरीके से काम करने का जज्बा होना चाहिए। हेल्थ इवेंट्स के जो डिटर्मिनेंट हैं, जो कारक है, जो निर्धारक हैं, उनसे रिलेटेड जो फैक्टर्स है उनकी जानकारी हमें होनी चाहिए, और एक साइंटिफिक स्ट्रेटेजी के साथ, साइंटिफिक पॉलिसीज के साथ एक रेगुलेशन व रूल्स के साथ में जो वर्ल्ड लेवल पर हो, कंट्री लेवल पर हो और स्टेट लेवल पर हो, उनसे हम हेल्थ इश्यूज को एड्रेस किया जाना चाहिए, स्वास्थ्य समस्याओं का समाधान करना चाहिए, तो हम ग्लोबल हेल्थ को अचीव कर पाएंगे। ग्लोबल हेल्थ के कुछ अगर कंपोनेंट्स की खास बात करें तो ट्रॉपिकल मेडिसिन, जिसके अंदर सारे इन्फेक्शियस डिजीज, आउटब्रेक एंड एपिडेमिक्स, पैंडेमिक्स आ जाते हैं। पब्लिक हेल्थ, जहां हम प्रमोटिव प्रिवेंटिव केयर की बात करते हैं। इंटरनेशनल हेल्थ, जहां हम देश की बाउंड्रीज को तोड़ करके विश्व बंधुत्व की बात करते हैं। इन तीनों को मिलाकर के ग्लोबल हेल्थ कंप्लीट होता है। कि ग्लोबल हेल्थ में हम सबको मिलकर के प्रत्येक व्यक्ति सर्वे संतु निरामया की भावना से काम करेंगे तो निश्चित रूप से हम पूरे वर्ल्ड लेवल पर एक हेल्दी एंड सेफ वर्ल्ड दे पाएंगे। ग्लोबल हेल्थ के इश्यूज चाहे नॉन कम्युनिकेबल हो या कम्युनिकेबल हो, सभी काफी इंपॉर्टेंट होते हैं और उनके लिए हमें फिजिकल एक्टिविटी, न्यूट्रिशन, ओवरवेट, ओबेसिटी, डिजीज प्रिवेंशन कंट्रोल, सब्सटेंस अब्यूज, HIV एड्स, मेंटल हेल्थ, injury, violence, environmental health, immunization, access to health care, NCDs, communicable disease, road traffic accident, सभी पर काम करने की जरूरत है। और यदि हम एज के हिसाब से बात करें तो प्रेग्नेंट मदर्स, नियोनेट्स, चिल्ड्रंस, किशोर, एडल्ट, यंग एंड जेरिट्रिक्स, ऑल एज ग्रुप्स पर काम करने की जरूरत है। बियॉन्ड द बाउंड्रीज काम करने की जरूरत है। और ये जो हेल्थ फॉर ऑल है या हेल्थ पर जो हम काम करते हैं तो उसमें नर्सेज का रोल काफी इंपॉर्टेंट हो जाता है। चाहे हम इन्फेक्शियस डिजीज को कंट्रोल करने की बात करें, इस कोविड पेंडेमिक्स में मैं अपने अनुभवों की बात करता हूं कि जब पहला केस इंडिया के अंदर आया तो रैपिड रेस्पॉन्स टीम्स के अंदर नर्सिंग स्टाफ ने काम किया। उसके बाद में चाहे हाउस टू हाउस सर्विलेंस हो, क्वारंटाइन हो, आइसोलेशन हो या वार्ड और आईसीयू के अंदर जहां पर जाने में हर किसी को डर लगता था, वहां पर हमारे नर्सिंग स्टाफ ने जाकर के काम किया। दे हैव बीन वर्किंग इन पेशेंट केयर, RRT, आइसोलेशन, क्वारंटाइन एंड रिस्क कम्युनिकेशन, जहां घर घर जाकर के पर्सन से बात करने में हमें यह पता नहीं था कि कौन से पर्सन को कोविड पॉजिटिव निकलेगा, बट हमारे नर्सिंग ऑफिसर्स ने, नर्सिंग स्टाफ ने हाउस टू हाउस से लेकर के अस्पताल के ICU एंड हाई एक्सपोज्ड एरियाज में भी काम किया और इस पेंडेमिक को कंट्रोल करने में काफी भागीदारी अदा की। नर्सेज रोल इन ग्लोबल हेल्थ, यदि हम ग्लोबल हेल्थ की बात करें तो मदर एंड चाइल्ड हेल्थ, जहां बर्थ एंड डिलीवरी, वहां पर नर्सिंग स्टाफ का बहुत बड़ा रोल है। आज हम जब NFHS 5 के डेटा देखते हैं, मदर हेल्थ एंड चाइल्ड हेल्थ में हमारे कंट्री ने बहुत अच्छा अचीवमेंट किया है। इसके लिए सभी मेडिकल प्रोफेशनल्स, स्पेशली नर्सिंग स्टाफ बधाई का पात्र है। ग्लोबल हेल्थ में प्रिवेंटिव एंड प्रमोटिव वर्क, जो प्राइमरी केयर है, उसमें रूरल एरिया हो, रिमोट एरिया हो, पॉवर्टी स्ट्राइकन एरिया हो, जहां पर फिजिशियन जाने में कतराते हैं, जहां पे फिजिशियंस की सर्विसेज अवेलेबल नहीं होती, वहां पर प्राइमरी सर्विसेज नर्सिंग स्टाफ ने, नर्सिंग ऑफिसर्स ने दी है। और वहां जो ग्रामीण है, ग्रामीण व्यवस्था है, उसमें बहुत अच्छा काम किया है। वैक्सीनेशन, चाहे यूनिवर्सल इम्यूनाइजेशन प्रोग्राम की बात करें या स्पेशल वैक्सीनेशन प्रोग्राम जैसा कि हमने कोविड वैक्सीनेशन में किया, बहुत इंपॉर्टेंट रोल नर्सिंग स्टाफ ने, नर्सिंग ऑफिसर्स ने प्ले किया। तो नर्सेज रोल जो ग्लोबल हेल्थ के अंदर है, उसकी जितनी तारीफ की जाए उतना कम है। वेलनेस प्रोग्राम हमारे प्रधानमंत्री जी के द्वारा चलाया गया, जो वेलनेस प्रोग्राम है, जिसके अंदर सब सेंटर और PSC तक हम वेलनेस सेंटर्स रन कर रहे हैं, वेलनेस चला रहे हैं, उसमें हमारे नर्सिंग स्टाफ का रोल काफी अच्छा है। रोल एंड रेस्पॉन्सिबिलिटीज ऑफ नर्सेज, यदि हम आज नर्सिंग डे के दिन नर्सेज का रोल एंड रेस्पॉन्सिबिलिटीज की बात करें तो मैं यही कहना चाहूंगा कि सभी नर्सिंग ऑफिसर्स को अपने फुल एक्सटेंट तक एजुकेशन और ट्रेनिंग लेना चाहिए। अपने फील्ड के अंदर जितना नॉलेज वो गेन कर सकते हैं उतना नॉलेज उनको लेना चाहिए और अपनी पूर्ण निष्ठा के साथ में समाज की हेल्थ के लिए, समाज के हेल्थ अचीवमेंट के लिए, कम्युनिटी हेल्थ अचीवमेंट के लिए काम करना चाहिए। nurses should be full partner with physician and other healthcare professionals in redesigning healthcare. Means अगर अपन डॉक्टर्स को ब्रेन कहें तो नर्व्स एंड ब्लड वेसल्स का काम जो है वो सारा नर्सिंग ऑफिसर्स और नर्सिंग स्टाफ कर रहा है। यदि ये कहें कि डॉक्टर एक आइडिया है तो एग्जीक्यूशन है वो सारा नर्सिंग एंड पैरामेडिकल्स के द्वारा किया जा रहा है। तो वी आर पार्टनर एंड इफेक्टिव वर्कफोर्स प्लानिंग and policy making require better data collection and an improved information infrastructure. Policy makers को नर्सिंग के लिए एक बहुत ही बेटर इंफ्रास्ट्रक्चर तैयार करना चाहिए जिससे कि उन्हें एक वेल वॉइस्ड एंड जो एक रेस्पेक्टफुल पे मिल सके और वो लोग ज्यादा बेटर तरीके से काम कर सके। थैंक यू एंड अगेन हैप्पी नर्सेस डे। थैंक यू मैम। हो गया ना? थैंक यू।
बहुत वेट करना
नहीं नहीं सर
ये तो नहीं चाहिए है
सर। थैंक यू।
बहुत अच्छा
अच्छा लगा सर आपसे मिलके।
आपका तो बहुत हमारा तो डॉक्टर एक पारिवारिक वो हो गया एक्चुअली।
Sorry for the inconvenience caused by technical error. Thank you, Dr. Dharmesh. For the speech on International Nurses Day. Now I would like to invite Madam Anu Kumari from UNFPA. Madam Anu Kumari, I hope you are there in meeting. Madam Anu Kumari from UNFPA. Kindly unmute yourself.
Yeah.
Yes,
Thank
ma'am.
you, ma'am.
Thank you very much for joining us. Thank you very much for joining us. We are delighted to have you in this meeting. So, before I request you to start, I would like to have your CV participants. So, Madam Anu Kumari is a sum total of 12 year experience of profession with RMNCHA and working on the position of aspirational district technical consultant Bijapur, Chhattisgarh. Work in TS India, Patna from 19 to 20 on position of capacity building facilitator for strengthening of MNCS services in Bihar state of implementation of Amanat Vyapak program of organization. And she is also having 3 years of managerial experience in HSB State Health Society of Bihar from 16 to 2019 December on position of state nursing consultant for implementation, monitoring and strengthening of pre-service nursing education program in Bihar MNCH plus A. She is also having working experience on rollout CPSC a program in Bihar by initiation of 6-month bridge course of CHO with support of Indira Gandhi National University, selection of district clinics, Dr. Sharma, kindly unmute yourselves. So I would like to have over to you, Madam Anu. Over to you for the presentation.
Thank you so much, ma'am. Currently, I'm working in Rajasthan on the position of a state midwifery consultant for this midwifery program from UNFPA. So, good evening, all the dignitaries, and special thanks to TNI President Dr. Jogendra Sharma from Rajasthan. So, basically, today we have talked a lot. So, I will be just presenting a brief presentation on evidence-based practice in midwifery. So, do I need to share the screen? I need to share the screen?
Ma'am, we made you co-host. You can share your screen.
Yeah. Thank you so much, ma'am. So basically, I will be talking in brief about evidence-based practice. So what is evidence actually? Evidence means we have proof that, yeah, it's correct, we can do it, and we are going to put it into the clinical practice. This is called evidence-based practice. So the evidence-based practice is an interdisciplinary approach to decision-making for midwifery care. So basically, we know that nurses, doctors, and other healthcare workers make a team. So when we have evidence, like for example, currently we are going to establish the midwifery-led care units. And as per NICE, National Institute for Health and Care Excellence, it recommends that MLCU is the safest birthplace for healthy woman experiences. So then first, what are the 3 areas we need to concentrate on while doing this evidence-based practice? So we need to have best available evidence in the midwifery care. Government of India guidelines, for example, MLCU guidelines we have. For MTSL we have, where we need to put it on. And for delayed cord clamping and all that. Then care contacts means we have to know that how much infrastructure support we have, how much governance support is there, how much is the clinical capacity training of the person, the nursing staff, that she is going to implement those procedures. And yes, we have to, of course, consider the client preferences. For example, currently, it has been observed that in MLCU, when we provide different birthing choices to the patient, then she feels that she is able to deliver in a more comfortable and a stress-free situation. So, of course, while doing the evidence-based practice, we do need to consider these things. That is, how much evidence, how much guidelines and all we have, what is the capacity of the clinical nurses, and what are the client choices. So the advantages of evidence-based practice in midwifery will translate into improvement of patient outcome